Again, at the request of the House Recording Studio, I will count down from 5 and then we'll start. The Committee on Education and Labor will come to order. Welcome to everyone, and I note that a quorum is present. The committee is meeting today to hear testimony on examining the policies and priorities of the U.S. Department of Health and Human Services. This is an entirely remote hearing, and as such, the committee's hearing room is officially closed. All microphones will be kept muted as a general rule to avoid unnecessary background noise, and members and witnesses will be responsible for unmuting themselves when they are recognized to speak or when they wish to seek to be recognized. Remember, a witness experiences technical difficulties during the hearing, please stay connected to the platform, make sure that you're muted, and use your phone to immediately call the committee's IT director, whose number was provided for you in advance. Should the chair experience technical difficulties or need to step away, Mr. Morelli or any other majority member is hereby authorized to assume the gavel in the chair's absence. In order to ensure that the committee's 5-minute rule is adhered to, staff will be keeping track of time using the committee's field timer, which is designated as in its own thumbnail picture, designated 001_timer, and will show a blinking light when the time is up. As a courtesy to our witnesses and to get to our questions as soon as possible, we will forego the customary roll call. Pursuant to Committee Rule 8C, opening statements are limited to the chair and ranking member, and I'll recognize now myself for the purpose of making an opening statement. Today, we're meeting to discuss the Department of Health and Human Services budget request for fiscal year 2022 and to examine the department's policies and priorities. Secretary Becerra, thank you for coming today and thank you for your time. I fondly remember a time when we both served on this committee as well as the Judiciary Committee, and I'm pleased to welcome you back. We look forward to discussing your vision for ensuring all Americans access to high quality health care. The importance of maintaining a strong public health system has never been more apparent. Regretfully, we are mourning the grim milestone of 600,000 COVID-19 deaths in the United States. Many of these deaths could have been prevented by a coherent response to the pandemic. For example, last night I attended an event at the Philippine Embassy, and I was informed that they had suffered 20,000 deaths. The United States is 3 times bigger than the Philippines, so at their rate, we would have suffered 60,000 deaths, not 600,000 deaths. Fortunately, the Biden-Harris administration is taking an evidence-based approach to reinvesting in the well-being of our families and communities. Most notably, the administration has worked with Congress to enact the American Rescue Plan, which helped more than half of our nation's adults get fully vaccinated, protected children from abuse and neglect, and expanded access to child nutrition, and put us on track to cutting the child poverty rate about in half. We addressed rising rates of domestic and gender-based violence, strengthened support for older Americans, and expanded access to affordable health care. These investments have saved lives and reaffirm that when we invest in the health of our communities, we provide people with the tools to care for themselves and their loved ones. However, severe challenges are still ahead. Secretary Becerra, you inherited a department that consistently sabotaged the Affordable Care Act and jeopardized access to health care for millions of Americans. Today, we look forward to hearing how the department's budget request, the Americans Jobs Plan, and the American Families Plan would finally help defeat the pandemic and expand access to high quality health care for people across the nation. Again, thank you for being with us today. Now recognize the ranking member of the committee, the gentlelady from North Carolina, Dr. Fox, for her opening statement.
Thank you, Mr. Chairman. There's absolutely no reason why this event should not be conducted in person in the committee hearing room. Vaccines were taken, mask guidance has changed, yet Democrats are pursuing permanent pandemic policies to exert more control over people's lives. And there's absolutely no reason why we should not treat every witness we have with respect and not do the roll call and waste everybody's time. The Biden administration inherited a pandemic that was winding down. but the administration now creating several new crises all on its own. There's a crisis at the border. Human traffickers and drug smugglers are ubiquitous and rampant. The Secretary of Department recklessly packed children into holding cells well beyond capacity limits. There's a crisis in our school systems. Students are most likely from 6 months to a year behind in their studies because the Biden administration insists on doing the bidding of teachers' unions leadership. There's a mental health crisis caused by Democrats' mandated isolated policies. Our children, particularly our young girls, are attempting suicide at staggering and mortifying rates. There's an inflationary economic crisis. Prices on consumer goods are skyrocketing because of the Democrats' failed stimulus policies and energy policies. And what does this administration do with these self-imposed catastrophes it thrusts upon the American people? The Biden administration proposes the most outrageous budget proposal in the history of our nation. The Democrats' bloated budget panders to the Democrats' most extreme socialist allies and leaves working class Americans to fend for themselves. Furthermore, the president's radical health care proposals shatter the bedrock of America's healthcare system, employer-sponsored health insurance, cheered on by socialist supporters in Congress. Obamacare 2.0 will be a disaster. The president's morally repugnant budget also forces the public to fund abortions. Secretary Becerra has much to explain and unpack at today's hearing, and committee Republicans look forward to getting answers. With that, Mr. Chairman, I yield back.
Thank you. Without objection, all other members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. on June 23rd, 2021. I'll now introduce our witness. The Honorable Javier Becerra is the 25th Secretary of the Department of Health and Human Services and the first Latino to hold office in the history of the United States. Previously served 12 terms in Congress, so we welcome him back, as well as serving as Attorney General for the state of California. We appreciate the Secretary for participating today and look forward to your testimony. Your written statement will appear in full in the hearing record. You're asked to limit your oral presentation to about a 5-minute summary. After your presentation, as you know, we'll move to member questions. Witnesses are aware of their responsibility to provide accurate information to the committee and therefore will proceed directly with his testimony. Secretary Becerra, it's good to see you today. You're now recognized for 5 minutes.
Chairman Scott, Ranking Member Fox, and members, thank you for the opportunity to appear before you, and great to be with so many friends and colleagues from the past. The Department of Health and Human Services is at the center of many challenges facing our country today. The COVID-19 pandemic has shed light on how health inequities and inefficient federal funding can leave communities vulnerable to crises. So now more than ever, we must ensure that the department has the resources to achieve its mission and build a healthier America. For HHS, the budget proposes $131 billion in discretionary budget authority and $1.5 trillion in mandatory funding. This budget underscores the administration's commitment to prepare the nation for the next public health crisis, to expand access to affordable health care, to address health disparities, to tackle the opioid and other drug crises, and to invest in other priority areas like maternal health, tribal health, and early childhood education. Of course, the fight against COVID-19 is not yet over, but even as HHS works to beat this pandemic, we must prepare for the next public health crisis. To start, this budget makes significant investments in our preparedness and response capabilities, including by investing in the strategic national stockpile and our public health workforce. It provides a new mandatory funding stream for the manufacture of medical countermeasures here at home to protect Americans from future pandemics and to create U.S. jobs. The budget also includes the largest fiscal year investment in the CDC in almost 2 decades. The budget reflects the president's commitment to expand access to quality, affordable healthcare for all Americans. It builds on the groundbreaking reforms introduced in the American Rescue Plan by permanently extending the enhanced premium subsidies that put affordable healthcare coverage within reach for millions more Americans. The budget also expands access to home and community-based services under Medicaid, critical services that allow older Americans and our loved ones with disabilities to live independently in their homes and communities. And the budget calls on Congress to take additional steps this year to lower the costs of prescription drugs and further expand and improve health coverage through additional benefits and public coverage options. Healthcare must be a right, not a privilege, and we will work to ensure that families across the nation are able to secure the healthcare they need. As we work to expand access to affordable healthcare and address the challenges of COVID-19 and future pandemics, we need to address public health crises that are already here, like violence in our communities and climate change. The president's budget increases funding to support domestic violence survivors. It addresses gun violence by doubling funding for firearm violence prevention research, and it allows HHS to play a major role in the administration's government-wide efforts to tackle the climate crisis by supporting research and programs identifying the human health impacts of climate change and establishing an Office of Climate Change and Health Equity. To ensure that HHS is equitably serving all Americans, the budget invests in reducing maternal mortality and morbidity that disproportionately impacts women of color. It builds on the American Rescue Plan state option to extend Medicaid postpartum coverage. It funds a range of rural healthcare programs and expands the pipeline for rural health providers. It includes a dramatic funding increase and advance appropriations for the Indian Health Service, and it invests in improving access to vital reproductive and preventative care services through Title X. To support families and build the best possible future for our children, the budget makes major investments to ensure high-quality childcare is affordable and low and middle income families, to low and middle income families, and it provides high-quality pre-K for all 3 and 4-year-olds. I think we all know that our experiences as children shape the adults we become. Support in childhood leads to success in the future. To address COVID-19's unprecedented acceleration of substance use and mental health disorders, the budget makes historic investments in SAMHSA to support research, prevention, treatment, and recovery services. To support innovation and research, the budget increases funding for NIH by $9 billion, $6.5 billion of which will go to establish the Advanced Research Projects Agency for Health, or ARPA-H, with an initial focus on cancer and other diseases such as diabetes and Alzheimer's. This major investment in federal research and development will leverage ambitious ideas to build transformational innovation through health research and the application and implementation of health breakthroughs. Finally, to ensure our funds are used appropriately, the budget invests in program integrity, including efforts to combat fraud, waste, and abuse in Medicare, Medicaid, and private insurance. Mr. Chairman, I'd like to close by recognizing the women and men at HHS for their outstanding and tireless work fighting COVID-19 to protect the health of their fellow Americans. To build back a prosperous America, we need a healthy America. We've taken important steps over the past few months to beat back this pandemic, to expand access to quality, affordable healthcare, to lower health insurance premiums, and to protect women's health at home and abroad. President Biden's budget requests build on that progress. Thank you.
Thank you very much. We'll now get to member questions, beginning with the gentleman from Arizona, Mr. Grijalva.
Thank you very much, Mr. Chairman, and thank you for being here, Secretary Becerra. It's good to see you again, my friend, and glad to have you in this very important and vital role in leadership that you've earned as Secretary of Health and Human Services. As you have heard already today, and the drumbeat will continue, that it is your fault, and by extension, the fault of the Biden administration for any perceived or real ills that are affecting the American people. The attack January 6th on our democracy, forgotten, just a mere walk in the park. 4 years under the previous administration of concerted efforts to dismantle healthcare, aggravate the disparity that already exists, undercut and sabotage Obamacare, that didn't occur. The tax cuts to the super wealthy that have skewed and affected the services that the American people need and demand from their government, and the punitive refugee and immigration policies that were the hallmark of the previous administration. So yes, recovering from those is difficult, and it's going to continue to be difficult. But I'm glad to have you in that role, Secretary, to lend some leadership some rationality, and some empathy and compassion to those issues that the American people need addressed and need addressed quickly. I think the efforts in your budget reflect that, and I'm proud to support it. One question, two questions that we saw during the pandemic response. First, the lack of a response, but as the response undertook itself, and certainly under the leadership of the Biden administration, even more so, the role of public health departments, county-based public health departments, how important they became in the vaccination process, in the outreach process, in the testing process, and what role do you see for public health going forward in those departments in particular, and what in the budget do you see as reflecting that? The other issue is childcare. That is a glaring need in this country for working parents, and particularly for working moms. How do you see that in the budget being reflected? And with that, I'll turn that back over to you, Secretary, for your response to that. Thank you.
Congressman, great to see you. Thank you for the question. Public health, one of the most important lessons we've learned is how ill-prepared this country was to reach everyone in America who needed help when it came to COVID. And part of the problem was we didn't have a good partnership and a clear safety net where we were interconnected with our public health colleagues at the state and local level. And what we should learn from that is that we should never again allow those gaping holes to exist in our national public health safety network. We are working closely with our partners. We are providing guidance and support, not just simply mandates. And so we allow on the ground work to be done by those closest to that work. But we will be there to support. We will not ever again, I hope, return to the day when we tell people you're on your own. It is time for us to work together. Public health must be addressed. We don't want to see another pandemic. And that's why we're preparing with our state and local partners to be ready to provide everyone in America with the healthcare that they need. And that for that, you need a strong safety net of public health. The second question, Congressman, was childcare. Yeah, I hope that you all succeed in passing the American Family Plans that the president has introduced, because it will be a generational type investment in our kids. We know that barely 1 in 7 children in America who qualifies, who's eligible to receive childcare, has a chance to get it. And we want to change that. We saw again with COVID what happens when you don't have adequate childcare, when you don't pay people who provide childcare services enough. And we can't experience that again. It's not just important for the health of our families, it's important for the health of our economy.
Mr. Chairman, thank you so much, and I yield back.
Thank you. Next would be the gentleman from South Carolina, Mr. Wilson.
Thank you, Mr. Chairman, and thank you, Ranking Member Virginia Foxx. Mr. Secretary, I agree very much with Ranking Member Virginia Foxx that we should be in person. I think it's actually insulting that we're not in person for you to be able to speak to the American people, for us to be present with you to speak to the American people. But actually, sadly,
go into it yet. Just
it was cited about Obamacare. We can always remember that the architect of Obamacare, Jonathan Gruber, said that it was built on the stupidity of the American people. And that means that we need to be open and transparent and somehow be working together in a bipartisan manner, but it can't be done with the level of isolation that I see here today. Mr. Secretary, in light of the recent cyber security threats, I was grateful, representing Savannah Riverside in South Carolina and Georgia, to see that the HHS is taking initiative to increase cybersecurity for the radiation dose reconstruction program affecting claimants under the Energy Employees Occupational Illness Compensation Program Act. Unfortunately, as a result, the National Institute for Occupational Safety and Health established a temporary moratorium on completing dose reconstructions, a key process for many claimants with cancer, meaning that workers from sites like the Savannah River site that I represent will not be able to proceed with their claims. What if any immediate alternatives can be done by NIOSH to implement, to ensure these claimants can proceed with their claims during the period, especially for those that are terminally ill?
Congressman, NIOSH plays a very important role, along with the Department of Labor, trying to make sure we're protecting the health and safety of our workers. The research that we do is indispensable. We will continue to do that work. We understand that there are, COVID has disrupted many things. And what I can commit to you is that if you believe that there's more that we could be doing, we can work with you. Please inform your team to reach out to my team, and we will work with you if you believe there's something more that we should be doing at NIOSH.
Well, thank you. In fact, I've got a really talented young lady, Emily Salibi, who's going to be in touch with your staff right away.
We'll be waiting for her call.
Hey, she's available 24 hours a day, 7 days a week.
We'll call her.
It's really good. Hey, Mr. Secretary, the policies contained in H.R. 3, President Speaker Pelosi's partisan drug pricing scheme, will stifle the very innovation that contributed to the America's Wuhan virus vaccine success. I'm grateful to co-sponsor H.R. 19, the Lower Cost, More Cures Act, which is produced by ranking members Kathy McMorris Rogers, Kevin Brady, and especially Congresswoman Virginia Foxx. Every provision in H.R. 19 is a bipartisan solution to drug pricing issues. Just last Congress, we sent 15 bipartisan provisions of the Lower Cost, More Cures Act to President Trump that he signed into law. The last thing I believe is that we need for government to hinder private sector investments in the ability of drug companies to develop treatments and vaccines, especially during a pandemic. With the White House Council of Economic Advisors and even the Congressional Budget Office in agreement that H.R. 3 would lead to fewer new drugs being produced over the next decade, do you agree that H.R. 3 will have a negative impact on the private sector's ability to develop treatment and cures for patients, which we encounter when we do encounter another pandemic?
Congressman, I think you and I and everyone agrees, regardless of what the legislation is, that we have to reduce the cost of prescription medication. We have to make vaccines available to all. And that requires us to continue to have the infrastructure in this country, both public, but also importantly, private, the private research and manufacturing capabilities to put out the vaccines, as we've seen occur with COVID. And what I will tell you is the president has been very committed, and he's been very public about this, that he wants to see the price of drugs go down. And he is willing to work with anyone. H.R. 3 is a proposal that not only reduces the price of prescription medication, it also saves the government quite a bit of money. But there are other proposals, as you've mentioned, and we are open to considering any proposal that reduces the price of prescription medication and protects the American people.
Well, thank you. And indeed, I'm so grateful for the leadership of Congresswoman Virginia Foxx. And I know she'd be happy to meet with you and explain the benefits and the superior status of H.R. 19 to 3. And with that, I yield back. Thank you.
I thank both of our questioners for staying within time. I forgot to ask people to maintain their time, because if everybody goes 1 minute over, will be almost an extra hour in the hearing. So we're going to try to keep exactly to 5 minutes. And I appreciate the first two for complying before I gave the warning. The next will be the gentleman from Connecticut, Mr. Courtney.
Well, thank you, Mr. Chairman and Mr. Secretary. It's very exciting to see you here today as one of our former colleagues. Congratulations on your confirmation, and also congratulations on your great work as Attorney General in California. You, again, were one of the AGs that stepped forward to defend the Affordable Care Act. And with passage of the American Rescue Plan, which we've now already seen in a very short space of time that well over 1 million new Americans are now enrolled in qualified health plans, as well as there's an expansion on the Medicaid side. So your work was not in vain. It was really critical to stand up in the ACA's hour of need. I also want to thank you for your great work in terms of protecting defrauded student borrowers. The news yesterday that Secretary Cardona, who hails from the state of Connecticut, was finally going to discharge the debt of defrauded student borrowers from ITT Tech. That's about 72,000 borrowers across the country who got totally ripped off by that institution. And the last administration, I mean, just disgracefully was refusing to provide relief for those students. Again, as Congresswoman Hayes can attest there's well over about 1,000, 2,000 kids in Connecticut that are going to get relief from that order. So again, your work as AG was not in vain. Mr. Secretary, I wanted to focus for a minute on a COVID policy which HHS adopted, which I support, which is that they basically suspended the 3-day hospitalization rule for Medicare patients to get coverage upon discharge from hospital. This has been a persistent problem over the years in terms of the way hospitals were coding patients as outpatient as opposed to inpatient. And we just had horror stories over the years of elderly patients with broken hips, ribs, who in some instances were in hospital for 5, 6, 7, sometimes 12 days, and then found out that they did not qualify for follow-on rehab care for their injuries because of the way they were coded as observation status, not inpatient. Again, HHS suspended that rule during the pandemic, which I think was a smart move. And, you know, I would like to at least flag this issue. There is a bipartisan bill, HR 3650. It is supported by over 30 geriatric groups, including AARP, the Committee to Save Social Security and Medicare, and many provider groups like the ER docs and others to really get rid of this surprise billing on steroids, because that really is what happens to patients when they, again, find out that they were coded in the wrong bucket and lose this coverage. Again, it's a very specific issue. I don't want to put you on the spot this minute, but I want to flag it for you that, you know, as the emergency order sunsets, that the system's going to snap back to where it was before. And we want to work with the department to either enact 3650 or get some policy. And I don't know whether you just want to react and comment. I do have one other question.
Congressman, first, great to see you again. And absolutely, I'm aware of this. Look forward to working with you. You understand that this is in statute. We have some constraints in what we can do, but we are absolutely willing to work with you. President Biden is committed to expand access to care, not reduce it. So we definitely look forward to working with you.
Well, thank you. And you're right. I mean, we do need to move forward by law. But the good news is we now have some data during the pandemic to show that maybe some of the cost issues that have raised concerns in the past really, in some ways, allowing people to get the care that's medically prescribed that actually reduces hospital readmissions. And again, just really quickly on HR 3, I just would note that that bill, the savings that it accumulates, which you mentioned, a big portion of that is actually getting invested in the National Institute of Health. The bill also totally protects and preserves the R&D tax credit, which pharmaceutical companies like Pfizer, you know, utilize and Moderna utilize. So, you know, we are leaving a framework that it still encourages investment in R&D. And I think, frankly, the collaboration of Congress in the CARES Act, other COVID bills, and the rescue plan, working with the private sector is a great success story. But frankly, the taxpayers and patients should not have to bear the brunt of unacceptable prices for medications like insulin that have been off patent for decades.
I agree with you, Congressman, and we're definitely looking forward to working with you and your colleagues to get something done to reduce the cost of prescription medication.
Thank you. I look forward to, again, congratulations. It's great to see you.
Great to see you as well.
Thank you, gentlemen. Yes, back. The next, I see on the minority side is the gentleman from Michigan, Mr. Wahlberg.
Thank you, Mr. Chairman. And Secretary Becerra, welcome back to the People's House. I wanted to follow up on a question that I know you've received in previous hearings, but now that you have had some time to talk with your team, perhaps you have had time to learn more about the rationale. In reference to efforts to reduce maternal mortality in the Centers for Disease Control and Prevention's budget justification, the budget uses the term on page 14 of that document, uses the term birthing people. Secretary Becerra, is there a reason the agency is using the term birthing people? And that's the only spot I've seen in the budget. But the term is used, birthing people, rather than mother in this context. Is there a reason?
Congressman, thank you for the question. And let me try to explain as I did the last time that use of the word birthing people is an effort to try to be not only inclusive, but accurate in the way we describe the individuals involved in this particular matter. And that would include mothers, that would include women of every, from whatever walk of life. But we want to make sure we're inclusive, and we want to make sure that we're using words that are accurate to convey what is going on.
Well, let me follow that up. At a previous hearing, you said the goal was to be precise in the language that's used. Why is mother not a precise term that's fully inclusive in every way, shape, and form? In fact, when we first began hearing that term, birthing person or birthing people, mothers and women in general, all across my district, expressed great concern that that was not a precise term. It was more given to agriculture, and it was pejorative in their mind. Mother is a term that is special, it's unique. It speaks specifically to the uniqueness of birth itself and who is capable of doing that, thankfully. Can you provide this committee with a definition of birthing person specifically?
And thank you for asking the question in a thoughtful way, because it does require a thoughtful response. Congressman, as you and I know, there are individuals, take for example, a surrogate, who will not be the mother of that child. There are individuals who do not categorize themselves as being male or female. And what we want to make sure is that we are not excluding anyone when we use particular terms. Certainly, birthing person would include someone, a woman who considers herself to be a future mother.
Well, again, as we see all across the course of your budget, mother is used, but one spot, birthing people, is put in. There's a concern that there's a camel's nose under the tent for social change and social engineering that goes against precise X and XY chromosomes and science itself. I express strong opposition to that on behalf of mothers and women all across my district, and I believe across this country. There is a time when we say what we really mean, and a mother is a mother, surrogate or otherwise. The term is understood, Secretary. I'd encourage you to remove that term. Perhaps you could also clarify another issue that has come up regarding the federal law on partial birth abortion. In your response to several members of Congress, you said you will follow that law under Roe v. Wade. However, it has not been clear if you recognize the law as defined in Section 1531 of Title 18 U.S. Code, which bans specifically partial birth abortion. In your response to Representative Joyce at your May 12th hearing, you stated that partial birth abortion is not a medically recognized term. With all due respect, Secretary Becerra, were you suggesting that doctors would not have to follow the law because they use different terms?
Congressman, thank you again for the question and the thoughtful way it was presented. Just as I am required to follow the law and do and will, every physician in America must follow the law. And I will repeat what I've said before. In this country, the law of the land is Roe versus Wade. A woman has a right to exercise her choice when it comes to reproductive health. We will defend that right and we will protect that right. And we recognize that we must do that according to the law that exists in America.
Well, I encourage you, even though you voted against the law that banned partial birth abortion, it is the law, Section 1531 of Title 18 U.S. Code. With that, I appreciate your response and I yield back.
Gentleman yields back. Next, the gentleman from the Northern Mariana Islands, Mr. Sablan.
Thank you very much, Mr. Chairman. Secretary Becerra, thank you for joining us. Congratulations on your new job. you have to make up your mind whether you're going to live in the East Coast or the West Coast, but you're always welcome here in Congress. Mr. Secretary, the President's budget clearly addresses barriers to Medicaid in the territories caused by Medicaid funding cap and a fixed federal local matching rate. Are you familiar with that section of the budget? And if so, can you elaborate on the administration's position on addressing Medicaid funding disparities in the insular areas, the territories, please?
Congressman, first, great to see you again. Always wonderful to have a chance to work with you. And yes, I'm familiar with this issue. You and I have worked on these issues in the past on behalf of the territories. And the president has also been clear where he stands on this issue. In his budget, he makes it very clear that he supports eliminating the Medicaid funding caps for U.S. territories and in aligning Medicaid financing for the territories with that of the states.
Thank you. I'm going to jump to another issue. I have several that I would submit for the record questions, but Mr. Secretary, starting in fiscal year 2021, your HHS is required to set aside $75 million for the territories from the special, of the total amount appropriated to the Child Care Entitlement States program. ARPA specifies that the $75 million is to be allotted among the territories in proportion to their respective needs. What data or formula did HHS use to determine the respective needs of each territory? Did you have that answer now or come back with it later?
Congressman, let me get back to you on the precise data or the formulation that was used. And I'm pretty sure you were asking about childcare, but it's a little difficult to understand your question because, at least for me, you were coming in and out. But I think it was with regard to childcare and how that funding would work for the territories. We can get back to you on that.
All right, and I will submit this question for you to review and give us some answers, Mr. Secretary. Let me also say before I forget and get to my next question, Mr. Secretary, I want to thank the men and women in your department, the men and women in various public health agencies throughout the nation, and of course to the American people, sir. Just the American people. Just today, my district, the Northern Mariana Islands, moved to the community vulnerability level green. This is great news. And since we started this pandemic, we've gotten, I think, 180 something infections. And of that, we've had 2 deaths in the very, very beginning from individuals who were coming in as visitors and brought in were sick before they got here, but of course, we couldn't have done any of this or kept our people safe if it weren't for the generosity of the American people. And I thank them for all the help. But my final question, Mr. Secretary, is, and I'm switching here. Under ARPA, the Northern Marianas has never been, until ARPA, the Northern Marianas has never been eligible for TANF. And as specified in ARPA, 7.5% of the TANF pandemic emergency assistance fund were set aside for tribal TANF programs and the 5 territories to be distributed in a manner deemed appropriate by the HHS Secretary, by you, Mr. Secretary. Could you elaborate, sir, on what factors you considered when allocating the TANF Pandemic Emergency Assistance Fund funding to the Northern Marianas?
Congressman, absolutely. Let me first say that I know the president believes this, and I feel it as well, that when it comes to pandemics or any type of crisis, we all reach out to everyone in the American family. And certainly, our brothers and sisters from the Mariana Islands and the territories are part of the American family. And so when it comes to something like a crisis or where it comes to the distribution of funding, we will do at HHS what we can to make sure that those funds first go to those most in need. And we try to do it in a way that lets us show a transparent allocation. And so what we're willing to do is work with your office if you'd like your team to give you a more precise answer as to what the Mariana Islands can expect.
Yes, sir. Thank you. And it is good seeing you again, Mr. Secretary. And Mr. Chairman, I yield back.
Thank you. The next I see on the screen is a gentlelady from New York, Ms. Stefanik.
Thank you, Mr. Chairman. Secretary Becerra, you talked about in your testimony the importance of focusing on access to healthcare in rural communities. And I represent a very rural district in northern New York. One of the challenges we've faced is there was a CMS redefinition of the term primary road. This significantly narrowed the eligibility criteria, and it's putting many of our rural hospitals at risk of losing their critical access hospital status. I am working with my colleague, Representative Delgado, across the aisle on addressing this issue, which is particularly challenging because it pulls the rug out from under these hospitals amidst a very challenging once-in-a-century pandemic. Can you commit to working with both of us on a bipartisan basis to address this misguided redefinition? Because this is going to impact rural districts across America.
Congresswoman, thank you for the question. I'll make sure that the team at CMS is aware that you're asking this question, and absolutely we'll commit to work with you and your colleagues to see where we can head on this.
My next question is regarding during the Trump administration, President Trump created the Conscience and Religious Freedom Division within HHS's Office of Civil Rights to review complaints of discrimination against healthcare entities that exercise their rights under the law to choose not to provide or pay for abortions or other healthcare procedures. It is unclear based upon the language in President Biden's budget, but do you plan on eliminating the Conscience and Religious Freedom Division? Yes or no?
Congresswoman, we are going to continue the work that it takes to protect the rights of all Americans, including religious freedom rights. We're going to do everything we can to be as aggressive as possible. My history, if you'll take a look at it, is one about defending the constitutional and civil rights of all Americans. And as a person of faith, I can guarantee you that we will do everything we can to make sure people are able to exercise their rights under the Constitution when it comes to religion, their faith, and so forth.
So that's a no, that you won't eliminate that division?
Well, we're going to continue to move forward in protecting people's rights and have an Office of Civil Rights that will continue to protect those. We have a number of cases that are coming before us. All of those, if they deal with constitutional civil rights, we, under the Office of Civil Rights, will be protecting those rights.
Great. It's a simple question. Is it a yes or no that you plan on eliminating the Conscious and Religious Freedom Division?
We will do nothing that impacts.
So you won't eliminate it. Great. I'll take that. You'll do nothing to eliminate it. Thank you. And I am familiar with your record. While you were Attorney General of California, HHS found the state of California to be in violation of federal law by imposing universal abortion coverage mandates. Just want to reiterate on the record, do you commit to upholding the enforcement of federal conscious protections and religious freedom laws, including the Weldon Amendment?
Congresswoman, we will continue to respect and not only follow the law, but enforce the law when it's under our jurisdiction, including the religious rights of Americans.
Great. So the answers I've gotten today are thank you for being willing to work with us on a bipartisan basis on the rural health care issue. No, there will not be an elimination of the Conscious and Religious Freedom Division, and commitment to upholding federal law when it comes to conscious protections. Thank you. I yield back.
Thank you. The next will be the gentlelady from Florida, Ms. Wilson.
Sorry, my fault. Good morning. Oh, shucks.
I can hear you. I could hear you.
Good morning, everyone. And Secretary Becerra, welcome home. We are so proud of you and everything that you have accomplished, and you've earned it all. So God bless you as you assume this high position. We are so proud of you. I just want everyone to remember why we are holding this hearing remotely. Our country lost over 600,000 people in a pandemic. They died. And my district is an epicenter, and people are still dying, and they will continue to die until we can vaccinate everyone and get rid of all of these conspiracy theories and misinformation. And members of Congress are going to continue to get sick and to die until all members of Congress are vaccinated. Now, with that said, I have a couple of questions for the secretary. And I think it would be best if I ask my questions in threes and then you answer them. Number one, school nurses. We have a police officer in every school. We tried to do that across the country. And I'm just wondering, with what has happened during this pandemic, do you agree that instead of having police officers in every school, we should focus on having a healthcare professional in every school? I have a bill that I have been filing for years. It's one nurse, one school. And I filed it through the legislature, through the Senate, and in Congress. And I want to know how you feel about that. Also, the American Rescue Plan includes a temporary 5% federal medical assistance percentage increase for states to expand Medicaid. I'm from Florida. I wrote my governor a letter asking him to expand Medicaid. And I want to know what you would say to Governor DeSantis to make him expand Medicaid, because I'm not having any luck at it. And then sickle cell anemia. What would HHS do to ensure that patients who are Medicaid and Medicare beneficiaries have equal access to all of the innovative therapeutics that are now available? Those are the first three.
Congresswoman, great questions and great to see you. You look the same. I love those hats. First, nurses in school. You and I probably remember the days when we were in elementary school and we knew that there would be a nurse there for us. And what a sin that we don't do that for our children today, right? Especially in our schools and most in need to have access to a nurse. If you help us pass the American Families Plan, I guarantee you, we will see far more nurses in our schools providing care to our children who really need it, because we'll give the resources to our local school districts to do that. So I hope we're able to work with you to pass the American Families Plan. Medicaid expansion, what would I tell any governor? You got elected to care for all the people in your state, not just some. We're offering you a deal that is hard to beat. We're going to actually help pay for the virtually almost 100% of that cost of that care for that individual who doesn't have access to care right now. And hopefully then you'll buy into it and find that it makes sense to cover someone, because they won't be getting their health care at the emergency room, the most expensive way they get it now. And so it's a savings, not just for you as governor, it's a savings for us as a federal government when we get people good care and they start getting the preventative care that keeps them from getting really ill and suffering from those chronic illnesses in the future that cost so much. Finally, sickle cell anemia. Congresswoman, I got to tell you, I think there's some bright news on the horizon when it comes to sickle cell. Finally, we're beginning to see far more investment. But this is where a program like ARPA-H is so critical, because it lets us zero in on these really difficult and devastating diseases and conditions that sometimes are, because they don't hit everyone, are far more expensive to focus on. This lets us target some of those, like sickle cell, certain cancers, and Alzheimer's, and actually come up with a solution. So I hope you'll be supportive of our efforts to start ARPA-H, which will let us go and save lives.
Thank you. Quickly, I chair higher ed, so I'd like to know, how will the HHS budget support CDC engagement and technical assistance for colleges and universities in the event of an outbreak, now that we're opening colleges and universities?
If you could be very quick, because the time has expired.
Congresswoman, I'll simply say that, as I said before, we can't have holes in our public health network. Certainly our schools, whether college or K through 12, have to be part of that network to protect everyone in the case of a pandemic.
Thank you, and I yield back.
Thank you. The gentleman from Georgia, Mr. Allen.
Okay, can you hear me okay?
Yes, sir.
Good. Mr. Secretary, thank you for joining us this morning. And obviously, my constituents are concerned with the cost of healthcare, and certainly some of the issues surrounding, surprise medical billing and that sort of thing. My first question, and again, I don't, I can't tell you where these numbers are coming from, but I'd like to know what your agency can give me that will tell me. Of course, Chairman Scott brought up the Philippines this morning versus the United States, and I understand we pay about 10 times per capita for healthcare in the United States versus other nations. Is that correct?
Congressman, I can't say that it's 10 times, but I know compared to the rest of the industrialized world, America has the most expensive per person cost of healthcare. Other countries that provide quality healthcare to all their people, whether it's Canada, France, Germany, Great Britain, they all do it for far less than we do.
Yeah, and that might explain why they're coming here for healthcare. Mr. Secretary, for each premium dollar and taxpayer dollar that is paid into Obamacare, how much actually, what percent of a dollar gets back to take care of a patient?
Congress, I'll get back to you on a precise number. If I recall correctly, at least close to 80% of any dollar that's spent must go into actual care. I know I'm probably off on that number. I remember from my days in helping craft the Affordable Care Act back in 2009 and 10 that we wanted to make sure that the lion's share of any dollar that a American consumer puts into healthcare would be spent on healthcare, not on marketing, not on profits. And so the lion's share of that dollar in the Affordable Care Act must be spent on care for that patient.
Right, and exactly. Right now, it has to wind through Washington to get back to take care of a patient, and that's what I want to know is exactly what Washington is taking out of that dollar. We have about 8 million jobs open in this country. 10 million people are not working. Of those 10 million, about 3.5 million are enhanced unemployment because of the American Rescue Plan. Mr. Secretary, strong economic growth allows more workers to enjoy the benefit of health insurance provided by their employers. Do you agree that getting people back to work would help decrease the number of uninsured individuals in the United States?
Anytime you have a job, Congressman, as you know, you're far more capable of affording the health care that your family needs. But to have a healthy economy, we need a healthy America. And that's why it's so important that we continue to expand healthcare and get people back to work. If we can get everyone vaccinated, get everyone to be safe, I think what we're going to do is see a prosperous America moving forward.
We've, got about, as I said, about 25 million work capable Americans trapped on welfare. And why does the Biden administration budget propose to continue COBRA subsidies and expand ACA subsidies, which make it more appealing not to seek employment?
Congressman, COBRA is a program that's been a lifeline for a lot of Americans who lose their job, and as a result, their health insurance that came with the job. COBRA,
yeah, I understand the purpose, but
okay. Well, it gives people a bridge until they're able to find other insurance, whether through their new employer or through some other means, whether it's under the Affordable Care Act or elsewhere. And what you want to do is make sure that you don't have these gaps. COVID exposed the gaps that we have in our healthcare system. The result of this pandemic is that because of these gaps, many Americans not only got sick, but died. And what we want to do is keep Americans alive. And the best way to do that is make sure they have access to good care from the start, not when they have to rush.
So we want to give those folks an incentive to go to work. And I got two more quick questions because I'm about out of time. Do you agree or disagree that Americans staying out of the workforce is bad for their mental, physical, and economic health?
Well, certainly we want to make sure everyone is ready to go back to work mentally, physically, and we want to make sure it's safe, that they've been vaccinated, they're not going to infect others. And I don't know many Americans. My dad, I don't remember a day when my dad didn't work, even though oftentimes he wouldn't be able to do the construction job he did because of the rains. He always found work. And so I think many Americans are out there looking for every good job they can, but let's make sure they're safe and they're vaccinated and ready to get back to work.
Well, I'm out of time, but the other question I had is surprise medical billing and where we are with that rule. And if you could cover that at some point in time in this hearing, that would be much appreciated. Thank you very much, and I yield back.
Thank you. Gentleman's time has expired, and I'm sure surprise billing will come up. I'll make sure of that. Gentlelady from Oregon, Ms. Bonamici.
Thank you, Mr. Chairman. Secretary Becerra, it's so great to see you. I'm very grateful that President Biden selected you. Congratulations on your confirmation as our Secretary of Health and Human Services. There are so many important issues within HHS, but I want to focus on two because of time limits: the Older Americans Act and the Community Services Block Grant Program. So the last year has been particularly difficult for seniors as they disproportionately face threats to their health and well-being. The president's budget proposes investing more than $1.4 billion to strengthen critical programs for older adults under the Older Americans Act and the Elder Justice Act. And this includes significant funding for nutrition assistance, vaccination efforts, caregiver support. So I was proud to lead the reauthorization of the Older Americans Act in 2016 and again in the last Congress. And I hope to make similar progress soon on the elder justice issues. So these programs are extremely important to not only my constituents in Northwest Oregon, but across the country. So in the early months of the pandemic, CMS issued guidance on visitation in long-term care facilities. And unfortunately, there was some confusion about the ability of the state long-term care ombudsman to maintain access to residents in the pandemic. So in response, when Congress passed the CARES Act, which included a provision I authored to clarify that the ombudsman shall have continued direct access or other access through the use of technology to residents of long-term care facilities during the public health emergency. Now, CMS eventually clarified their guidance, but I'm concerned that the early confusion may have denied residents these critical protections and oversight from the ombudsman. So I am hoping that CMS makes access to this vital program, these services for long-term care residents, a priority going forward. So what can your department do to make sure that these mostly volunteer but very important advocates have access and the support they need to carry out their important work?
Congressman, thank you for the question. And thanks for pointing out how critical it is that we have accurate data and that we're communicating it well, because in a pandemic, a minute can make the difference between someone getting too ill or surviving or not. And so I think at CMS, what we're going to try to do is recognize that we are the possessors of very valuable data. We'll try to work with our local communities as best we can. Please let us know if you think that we're not doing that. But we are learning as well. I think CMS learned many important lessons as a result of COVID and how we can try to get information out faster. But I look forward to working with your team. I can't give you any precise answer.
Thank you, Mr. Secretary. The Long-Term Care Ombudsman Program is so important because it really provides a voice for residents of long-term care facilities. So I chair the Civil Rights and Human Services Subcommittee, and one of my top priorities this year is to advance the long overdue reauthorization of the Community Services Block Grant Program. So I'm working with Congressman G.T. Thompson toward a comprehensive update of CSBG. And I know others on the committee look forward to working with you to strengthen these vital anti-poverty programs. And I particularly want to thank you for the support for CSBG expressed in the administration's budget. I understand this is one of the few presidential budgets to propose an increase in funding since the program began. The nation's community action agencies, or CAAs, are funded by community service block grants, and they have served an essential role during the pandemic. So the CARES Act invested $1 billion to help CAAs expand their services. And the legislation also raised the CSBG eligibility criteria to 200% of poverty line, which provided greater flexibility, and I support that increase. So what is your role, what is your view on the role of community services block grants as an anti-poverty tool? Would you commit to working with us to provide communities with the flexibilities or other updates to the program that can strengthen the abilities of the community action agencies to better serve those in need?
Congresswoman, indispensable. You've described why these services are indispensable. Thank you for the support in the CARES Act to give us that extra funding. The president makes commitments to continue that forward. And if you're able to pass the American Families Plan, we can make truly generationally changing investments in making sure we're taking care of our folks.
Thank you. And again, the Community Services Block Grant Program has been an essential anti-poverty program. And I look forward to working with you and the administration, and again, committed to this bipartisan approach to make sure that we can continue the great work of our community action agencies. So thank you, Mr. Secretary. Again, it's wonderful to see you. Thank you for your work, and I yield back. Thank you, Mr. Chairman.
Thank you. Next, that's the gentleman from Kentucky, Mr. Comer.
Thank you, Mr. Chairman. Secretary Becerra, I was able to lead a group of my colleagues on the House Oversight Committee down to our southern border in April, visited New Mexico and Texas. We spoke with Border Patrol agents and visited DHS facilities housing unaccompanied children. Since then, Vice President Harris is yet to see this crisis in person and is honestly blatantly avoiding the realities of the crisis situation we have at the southern border. Mr. Secretary, isn't it correct that under current law, unaccompanied migrant children who cross the border from countries other than Canada and Mexico are turned over to the custody of HHS?
That's correct, Congressman.
Given the sheer number of children who have been coming in recent months, isn't it true that HHS stood up a dozen emergency intake sites to be able to care for the influx of children who were arriving?
Congressman, we did what we were obligated by law to do, and that is to care for these kids. And so if we couldn't find a state licensed facility where you typically would send a child for such care, we did what we needed to do, establishing, standing up, as you said, some of these sites to be able to provide those care, the basic services that we expect for any child.
Mm-hmm. And isn't it true, as Politico has reported, that HHS reallocated $850 million that Congress originally allocated to rebuild the nation's strategic national stockpile of medical equipment?
Congressman, we did use the dollars that are available to us within our budget to try to pay for these services. We could, we have a choice, either find the money to pay for these or don't provide the services. By law, we have to provide the services, and I think our moral conscience would tell us that we have to provide the services for these children as well.
Well, I know it's a crisis situation. Given the surges we've seen, do you believe it was prudent for President Biden to reverse many Trump policies that were deterring migrants from making the dangerous journey at the hands of smugglers into our country without any plans to replace those policies?
Congressman, I won't weigh into the discussion of immigration policy other than to say the president made it very clear a child, whether it's your child, my child, or any other child, is not going to face harm in this country. We can't decide that the fate of that child may end up having to return to the home country. That's an immigration process. But what I can tell you at HHS, our obligation is to make sure that while they're here, even if only temporarily, we're going to make sure they're cared for.
I don't want any child in harm's way either, but with all due respect, Mr. Secretary, the Biden lack of border policy is inviting more and more unaccompanied migrants to make that dangerous journey. And I strongly encourage you to encourage the president or the vice president, if she's still in charge of border security, to come up with a plan and take this seriously so we can deter the record numbers of unaccompanied minors and illegals who are crossing that border every day. Mr. Chairman, I'd ask that the Politico article I referenced be entered into the record.
No objection.
Thank you. Switching gears, Mr. Secretary, I'm also concerned with the administration's waiver of patent protections for successful COVID vaccines. I'm afraid that as our country begins to recover and we are learning more about the lingering effects of COVID on public health, these waivers will damage the outlook for the development of boosters and set a dangerous precedent for future vaccine developments. Mr. Secretary, can you provide some insight into how we should prepare for future pandemics if we cannot ensure the federal government is not devaluing the R&D they worked so hard to recover?
Congressman, thanks for the question. And as I mentioned in my opening statement, we're already in the works preparing for the next pandemic or next healthcare crisis. We don't want to wait. We can take the lessons learned from COVID to help protect the American people. But I do want to caution that what the president said with regard to the TRIPS treaty that we have that deals with pharmaceuticals and how those can be distributed across the nation, across the world, he made a commitment to work with the WTO to see if there was a way to make those vaccines available to the rest of the world quicker. He did not waive any authorities. Those are all part of any negotiation with regard to those treaties and the treatment of the patents and protections that those medications have.
Okay. Thank you, Mr. Secretary. I just want to close with this one concern. I'm concerned regarding the inequities in the distribution of the Provider Relief Fund. In my congressional district in Kentucky, assisted living providers who care for over 2,000 elderly individuals across 37 communities, the population that was most vulnerable to COVID, were allocated less than 1% of the Provider Relief Fund. That's about $3 billion, and have only received about a third of that. The average age of resident in assisted living is 85. These vulnerable individuals need assistance with daily activities such as eating, using the restroom, taking medication, dressing, etc. Over 40% of assisted living residents have Alzheimer's or some form of dementia. Due to PPE needs, workforce needs, and occupancy declines, assisted living caregivers have suffered over $15 billion in losses in 2020 and $230 million in Kentucky alone. I just wanted to throw that in there, Mr. Chairman. Thank you, Mr. Secretary, for being here, and I yield back.
Thank you. The gentleman from California, Mr. Takano.
Thank you, Mr. Chairman. Good to see you, Mr. Secretary. Congratulations. I'm going to go right into it. Mr. Secretary, I'm going to give you a moment to maybe share with the American people how the president's budget included in the American Families Plan calls for an investment of $250 billion for child care expansion and $200 billion to provide high quality universal pre-care over 10 years. How that would provide relief to parents and ensure that children are cared for in environments that will support their learning and development.
Congressman, great to see you, and thank you for the question. I think it's pretty obvious after COVID what happened in America when we found parents unable to find quality, safe childcare for their kids. It disrupts the work effort. It disrupts the child's education. I don't think any of us want to experience that again. We're still seeing the effects of COVID on families as they try to get back to normal. We have to start paying our caregivers decent salaries so that we can attract good people to care for our kids. Kind of strange that we are willing to pay a scientist or a merchant a great deal of money, but the people who train these children to become that successful scientist or merchant, we're not willing to pay them good money. And so I think we've learned the investment the president wants to make is so that every child has access to decent childcare. We want to make sure every 3- and 4-year-old has access to pre-K. Those are the kinds of things that are good for America, not just for that family or that child. So we look forward to working with you to pass the American Families Plan.
I'll work with you. I commit to that, sir. Secretary, Professor Taryn Morrissey of American University has said that on average, the early care and education settings attended by many young children, particularly low-income children or children of color, provide quality at levels too low to adequately promote children's learning and development. How would the administration's proposals ensure that low-income children of color are not left with low-quality child care options?
Well, as you know, President Biden has made it a commitment. One of the principles of his administration will be equity. And you cannot have equity if you're not giving kids access to good quality care, regardless of where they live. Your zip code should not determine the quality of your care. And this administration is committed. And I can tell you that not just as secretary, but as who I am as a person and what I have fought for all my life, that at HHS, we're going to make sure that if someone is going to get funding for healthcare, for childcare, we're going to make sure that they're held accountable to make sure it's good quality care for that child and that family.
Thank you for that, Mr. Secretary. Secretary, as you know, I chair the Veterans Affairs Committee, and I'm happy to report that during the pandemic, we had very low infection rates and very low death rates due to the pandemic at our community living centers, which are our long-term care facilities. Similarly, in California, Secretary Imbasciani at CalVets saw that we had veterans homes in California that had virtually no infections compared to other settings across the country. And as you know, 40% of our COVID fatalities are attributed to congregate living centers. And I note that under the Trump administration, there was a relaxation of regulation and oversight through CMS of the for-profit facilities across our country. Do you intend to revisit the regulatory environment and the oversight environment of these facilities Most importantly, the Trump administration amazingly relieved these facilities of the requirement to retain infection control expertise. Do you have a comment on that?
Congressman, I may no longer be the Attorney General for the state of California, but I take with me much of the work that I did to do oversight and accountability to make sure that those who receive taxpayer dollars to provide services to the American people fulfill their commitment. And I can guarantee you, and I mentioned it in my opening statement, that program integrity is going to be one of the hallmarks of the work that we do to make sure that no one is taking advantage of taxpayer dollars and that people receive the care that they're entitled to.
Well, Mr. Secretary, I believe we need to really learn the lessons of the pandemic and just how these facilities across the country, long-term care facilities, could see such devastating death rates and infection rates. Turning to a different topic very quickly, I note that in the territories that there's a lack of portability for Medicaid benefits. Is that something that we can count on your help to address?
Congressman, absolutely. I addressed that earlier. Absolutely.
All right. I yield back, Mr. Chairman. I kept within my 5 minutes.
Thank you. Exactly. The gentleman from Idaho, Mr. Fulcher.
Thank you, Mr. Chairman. Mr. Secretary, thank you for spending some time with us today. I represent the great state of Idaho, and I would like to talk to you about enhanced short-term plans, or ESTPs, for a moment. Idaho's ESTPs have been a critical option for people in my state who may be changing jobs, in temporary employment, or starting a new job and awaiting health insurance. These plans are comprehensive, covering the essential health benefits required under the Affordable Care Act. In many cases, Idaho's ESTPs have higher actuarial values than those offered by the Affordable Care Act. Unlike the ACA plans, they can be offered anytime throughout the year and have up to a 3-year renewal. Finally, our state insurance code's consumer protections apply to all of our ESTPs. These plans are needed for people who don't qualify for an ACA subsidy. As people get back to work, they will need that kind of flexibility in health insurance. The alternative for them is to wait for coverage, having none if something happens. Mr. Secretary, will you commit to working with our state officials to ensure there is a workable option with ESTPs, given their success and given the need to ensure people have affordable access to health insurance as you review short-term health plans?
Congressman, thank you for the question. This one's important because we want everyone to be able to afford their health insurance coverage. We want everyone to have comprehensive plans. You all passed legislation on surprise billing because oftentimes people thought they had certain levels of coverage and found out when the bill came that they didn't. We don't want Americans to be duped. And so what we want to make sure is that they get strong, affordable coverage that they can afford. And I'm sorry, that they know they can count on. And the ACA provides protections against junk plans that don't really provide real services, that leave people in the lurch holding on to a very expensive bill. And so any plan that can provide quality care, guaranteed at a good price, we'll be supportive of.
Including the enhanced short-term plans?
Well, if they provide those levels of coverage at a good price and don't shock people with bills that won't be covered by the insurance company, we are willing to look at that. But what we don't want is for these junk plans to proliferate.
So then you will consider ESTPs as an option for those people who can't qualify for the subsidy?
We certainly will take a look at any plan that offers high standards for all Americans at affordable prices.
Okay. Many of the families, certainly in my state, I'm sure this applies elsewhere, many families and members where they're school teachers or other public servants face what we call the family glitch problem, where the employee is covered for health insurance, but not their spouse or their family. And does HHS have a plan to address the cost of coverage for those families, and if they make too much to qualify for an ACA subsidy?
Congressman, we're willing to work with you. As you know, we're going to need Congress to come up with a solution for some of these issues because it's in statute. And so we absolutely are willing to work with you to make sure that everyone has access to that affordable coverage.
Okay. All right. Thank you, Mr. Secretary. I'm going to shift gears to a different topic right quick before my time's up. Secretary, on April 15 of 2021, HHS proposed a rule change to Title 10 of the Public Health Service Act that would revise the family planning program regulations and require all recipients of Title 10 funds to counsel and refer women for abortions. Not only would this rule violate the conscious right of healthcare providers, but would also undermine Title 10, which protects taxpayers from being forced to fund abortions. Mr. Secretary, what will your department do to ensure that it does not exceed its constitutional power by implementing broad and coercive mandates such as that?
Congressman, thank you for the question. This one's important because we want all our families to know they have access to good quality care, and Title 10 has been so important for families who need family planning services. We will, as I've always said, make sure that we give everyone, including women, access to the kind of coverage they need. We will protect their rights for that, and we'll make sure that we follow the law as we do so. We believe that in the program that we have on Title 10, not only are we expanding access to care for mostly women, but families altogether, we're going to do it in a way that conforms with the law.
Mr. Secretary, I thank you for the answer. And I'm just about out of time, but that rule change does violate the conscience right of our healthcare providers. And so please consider that as you move forward. Mr. Chairman, I yield back.
Thank you. Sagan. The next one I see is the gentleman from New Jersey. Are you still on the screen? Mr. Norcross? Gentlelady from Washington, Ms. Jayapal?
Thank you, Mr. Chairman and Secretary Becerra. It is so wonderful to see you here today and to say that shortly after your visit to Seattle, we were so proud to become the first city, major city in the country to reach a 70% vaccination rate. That's fully vaccinated. We're actually, I think, at 78% for first round of vaccinations. So we're proud to lead the country, Mr. Secretary, and it's because of the administration, because of the American Rescue Plan, and we thank you. You know, I think that we are still seeing so many of the catastrophic effects of the COVID-19 pandemic, and I wanted to ask you about three specific things. One is about the global pandemic. In the American Rescue Plan, $6 billion was allocated to Health and Human Services for COVID-19 vaccine development, manufacturing, distribution, and supply chains. Could you provide an account of how much of that money has been spent and how much is left that we can immediately put towards really improving our domestic production, investing $25 billion into production of vaccines that we can send to places around the world so we can combat this pandemic globally?
Congresswoman, first, congratulations on the work that your city has done. It is phenomenal, and it was a great visit that we had, and I could see why you got to 70% so quickly, because I could see how well everyone was working together as a team. On the question of the dollars, and if I get these wrong, my team will make sure that we correct them. And so let me just break down the $6 billion. $2 billion of the funding has been going to operations. Another $3 billion is being used for antivirals. Thanks as well to the American Rescue Plan, the president is working on the $10 billion that were approved for domestic manufacture capabilities for PPE and pharmaceuticals. And we're going to be investing in this budget that we presented, $21.5 million or so in new funding for the Resilient Supply Chain and Shortages Program. So we're doing what we can to prepare. We're doing what we can to make sure that we recoup what we had to use, and we're going to try to be ready for anything coming at us in the future.
Thank you, Mr. Secretary. So you're saying there's nothing left of the 16 billion. Is that correct?
Well, I don't know if there's any, a lot of it's been earmarked. We probably still have some there, and we could try to give you the precise numbers when we follow up with your team if you'd like.
Great. Well, you know, I think we're trying to work very hard to make sure that we invest $25 billion into addressing and getting vaccines to countries around the world, because as you know, low-income countries have received just 0.4% of vaccines. And we're not going to defeat this crisis unless we defeat it globally. In addition to the need for greater global vaccine access, COVID-19 has shown us why ensuring healthcare for all is critical. Right now, there are critical improvements to Medicare that President Biden has committed to. Can you speak to the importance of lowering the Medicare eligibility age to 60 so that we include 23 million additional Americans, including nearly 2 million uninsured individuals, and improving Medicare benefits to include dental, vision, and hearing? And will you work with us, Mr. Secretary, to make that a reality for Americans?
Yeah, and before I give the answer to that, can I just add that the 580 million vaccines that President Biden has committed to the world, to the COVAX program, but globally to make sure they're out there, those surplus vaccines that we can make available will help tremendously in our commitment to be a partner in trying to help the world get vaccinated. And that's part of our ongoing work. And we've been able to do that because we've been able to get so far along, as you've mentioned with your city, in vaccinating Americans. So those surplus vaccines will be made available to the world. In regards to the benefits of lowering the age of eligibility for Medicare or expanding services like hearing, vision, dental to seniors and Medicare, let me tell you, it's due. We need to move forward. The president is supportive. He'd like to support anything that you all do in Congress. There's a number of ways to get there, but what we're hoping to do is to continue the work that has increased the number of Americans who have affordable care, whether it's through the ACA, whether it's through Medicare. We want to see more Americans get covered till every American has that right to say, I have access to healthcare.
Fantastic. And I have just a few seconds left, but I do want to give you a chance to address the consequences of Donald Trump's zero humanity policy to separate children from their parents, which has a conspicuous silence from many of my Republican colleagues. 3,900 children were separated by this policy, and we cannot yet reconfirm reunification for 2,100 families. Secretary Becerra, just tell us how your administration has been tackling this terrible problem created by the former administration.
Congressman, and I know the time has expired, so I'll be very brief and simply say, I have 3 daughters. Don't let anyone try to separate me from my daughters. I think every parent thinks the same way. We must think of that, not just with our own personal children, but with all the children that we have in this country. And we're going to do everything we can, at least under this administration, to keep families together, not to break them apart.
Thank you, Secretary. I wish we could hear more from you because you've done so much, but I'm respecting that my time has expired, Mr. Chairman. Thank you.
Thank you. The gentleman from Indiana, Mr. Banks.
Thank you, Mr. Chairman. Mr. Secretary, I'm deeply concerned.
I can't hear.
Can you hear me now? Okay. Can you? I don't know what I'm doing wrong. Mr. Chairman, I'll have to pass.
The gentleman we'll come back to you. The gentleman from Pennsylvania, Mr. Keller.
Thank you, Mr. Chairman. And I would like to thank the Secretary for being here today. Retroactive and direct and indirect remuneration, or DIR fees, are a huge problem for community pharmacies across North Central and Northeastern Pennsylvania. These fees are applied by pharmacy benefit managers on community pharmacies after the point of sale, sometimes months afterwards. It is hard to think of another industry that deals with such unfair treatment. According to the fiscal year 2022 budget justification, DIR fees increased by more than 91,500% between 2010 and 2019. Earlier data showed that DIR fees grew by 45,000% between 2010 and 2017, meaning this increase more than doubled between 2017 and 2019. According to the National Community Pharmacy Association, the average community pharmacy pays more than $80,000, pays more than $80,000 per year in DIR fees. This is simply unsustainable and unacceptable. Mr. Secretary, DIR fees are clearly creating problems, driving pharmacies out of business and increasing drug costs for those who rely on prescription drugs, particularly seniors. Do you support action to prevent pharmacy benefit managers from imposing such crippling retroactive fees on community pharmacies?
Congressman, you've touched on something that is part of this dilemma that we have with pharmaceutical cost, the cost of prescription medication. And the reason why I think so many of us, and I know you probably as well, want to get to a solution that reduces the cost. I am willing to work with you to try to see what we can address in these areas, but I will tell you that I think some of those solutions are going to have to come from Congress, because much of the dilemma that you're raising is a statutory problem that you face. But we're really willing to work with you, provide the technical assistance, because what we cannot do is find that the person who loses at the end of the day because of those difficulties, bureaucratic or otherwise, are consumers who need those drugs.
Yeah, and it's, a lot of times it's our senior citizens with their Medicare. In 2018, HHS and CMS included DIR reform language in a proposed rule, but ultimately it was not included in the final rule. Would you support reviving that proposed rule?
Congressman, I can commit to work with you and our team at CMS to review that again and see where we can go.
Yeah, but the rule we're talking about was HHS and CMS. So if this is rulemaking and we can do something that is quicker than Congress, would you be willing to take a look at that and do that?
Absolutely committed to taking a look at that, and we can stay in touch, and your team can follow up with our folks at CMS and here at HHS.
We'll most definitely do that. The DIR reform to reduce senior drug costs act would require that price concessions be included in the negotiated price at the point of sale to a Medicare beneficiary. This would obviously require HHS involvement to be implemented. How do you feel the implementation of ideas like this might be at the agency level?
So there we will do what we do with all of these proposals where we have to do through regulation. We'll take we'll take a thorough look, a deep dive into them. What we'll do is then put out any proposed regulation out for comment by you, by stakeholders, by the public, get the feedback. And then if we think we have something that's been pretty well baked, then we'll put it out there and roll it out, and hopefully it can take effect. But we'd have to first work with you and stakeholders in the community to make sure that this is an idea that actually has good legs.
Yeah, we need to make sure that we look at the cost of prescription drugs, because it is negatively, the increases are negatively impacting not just the pharmacies that have to pay these DRR fees, but also the constituents with access to them.
Absolutely agree.
As you see it, how can Congress and the Department of Health and Human Services work together to find additional solutions to this issue?
We're ready to provide whatever technical assistance you might have as you all propose legislation to deal with this. We are prepared to work with you. If there's some regs that you all think we should be proposing, we'll work with you as we get ready to promulgate them. So what we can do is put them on the ground as quickly as possible and let them go live.
I appreciate the willingness to be able to work with the department on finding solutions to these problems that are affecting so many of all of our constituents, and really get at the root cause. We need to get at the root cause of why these costs are happening, and help our constituents with access, because we want to make sure that our pharmacies succeed, so that our constituents can have the choice and the access to the necessary drugs. So I do appreciate this. Their prescription medicines are so important to many people's well-being. So thank you, and I yield back.
Thank you.
Thank you. The young lady from North Carolina, Ms. Adams.
Thank you, Mr. Chairman. Thank you, Ranking Member Secretary Becerra. Thank you for your time today, particularly given since you've testified thrice last week. You explained various priorities in your opening, highlighting how America's workforce continues to face challenging circumstances. For instance, the pandemic has wrought severe impacts on essential workers, particularly women of color in America. The COVID-19 vaccination workforce has been expanded through the PrEP Act and efforts across North Carolina to donate freezers for the storage of vaccines. Let me ask you, although the CDC's budget was increased by 21%, the National Institute for Occupational Safety and Health was level funding for 2022. And NIOSH is the only agency in government with occupational health and safety research. And during a prior workforce protection subcommittee, we learned that there was virtually no workplace tracking of the COVID outbreaks during the pandemic. So what does this suggest about the priority that the administration is placing on the worker health and safety inside CDC?
Congresswoman, first, great to see you again, and look forward to working with you closely on this and other issues. What I can tell you is that CDC, and if you all help us with this budget, getting it the largest increase in funding in 2 decades, we will make sure that we're investing in all the research that has to happen. NIOSH, remember, does the research side of this. We don't do OSHA side, which is the actual enforcement side that's done through the Department of Labor. But I commit to you that we're not going to let any research lapse or go undone that helps us understand how we better protect our workforce, because we saw what happens when we don't protect those essential workers, many of whom are people of color.
Absolutely. Expecting mothers who experience discrimination in medical settings have limited awareness about other maternal health care providers included in their health plans provider network. So how can HHS increase patient access to appropriate in-network providers?
Congresswoman, thank you for asking this. And my wife thanks you as a high-risk OB/GYN. Thanks you for not just asking it, but for being a fighter on this issue. Listen, it is incredible to believe that in this country, the richest nation, the democracy in the world, we have some of the worst outcomes for women when it comes to being pregnant. And the mortality rates, the maternal mortality rates for some in our country, especially for our women of color, it's devastating. And so President Biden made a commitment, and we're going to have resources here to tackle this, to provide women with better care, to avoid that mortality that might occur, the bad morbidity results. And by the way, we're challenging states to accept an increase in Medicaid funding so that we can keep a woman receiving postpartum care, not just for 60 days, but for a full year. And what we hope is that the states will take us up on that challenge where we're paying for most of it so that women can continue to receive the care they need after delivery.
Right. Increasing workforce diversity in the field of maternal health requires additional support for allied health professionals, which includes lactation consultants, nutritionists, dietitians, laboratory scientists, mental health counselors, and speech language pathologists. So how will the FY 2022 budget expand job opportunities for these critical healthcare providers who are underrepresented in the maternal health sector?
Congresswoman, if you all help us with our budget and passing the American Families Plan, we will have an additional $3 billion that we'll be able to make available to improve in maternal health. We have a $200 million program called the Maternal Mortality Review Committees program, where we help those at the local level know where they have to put the resources to help women have good outcomes and stay healthy. And so there are a number of ideas that we're working on, but we're going to need your help to make sure this budget gets through.
Great, great. Thank you so much. You have my support. Thank you for all the great work that you're doing. Mr. Chairman, I yield back.
Thank you. I understand Mr. Banks is available now. The gentleman from Indiana, Mr. Banks.
Yes, Mr. Chairman, we'll try this again.
Good. Very well.
Mr. Secretary, your budget proposal is the first budget proposal in 45 years that doesn't include the Hyde Amendment and Hyde Amendment protections preventing taxpayer funds to go toward paying for abortions. If that's true, if that is the case, as it appears to be, that would make your and the Biden administration the most pro-abortion administration in the history of this country. So what I want to know right now, and I wonder if you would commit to, is if you will commit to never directing taxpayer funds to go toward funding partial birth abortion.
Congressman, what I can try to make sure I do is guarantee to you that we're going to follow the law. And as I just finished saying to Congresswoman Adams, we want to make sure we're helping women be healthy and stay healthy if they're going through pregnancy. And so Mr.
Secretary, can we expect you to commit to not funneling money toward paying for partial birth abortions?
We
It's a
will
simple
not.
question.
We will not send money anywhere we're not allowed to by law, Congressman. We will make sure that we enforce the law and provide the health protections and services that Americans are entitled to, including women.
Mr. Secretary, I'll ask you again, will you commit to not sending our taxpayer dollars to go toward funding partial birth abortion?
Congressman, you're asking a question, and what I must say to you is that there are scores of low-income women in America who are not receiving the care that they need and are entitled to. We're going to make sure that we leave no one behind, but we're going to do that by following the law. And so if you're a woman in America, we want to make sure you have access to reproductive services that you're entitled to under the law.
Mr. Secretary, the HHS Office for Civil Rights contains a Conscience and Religious Freedom Division that enforces nearly 24 federal laws protecting conscience in healthcare and human services, including protections against coerced participation in abortion and assisted suicide. That division is currently being overseen by a political appointee named Laura Durso, with a long history of left-wing activism. Here is a sampling of some of the outrageous things that Laura Durso has publicly said about the Conscience and Religious Freedom Division. In a tweet, she said the division, quote, sends shivers down my spine, and that, quote, any policies that come from it will only enable discrimination and pain, end quote. In an interview, she called formation of the division, quote, insulting at best, and falsely said that the division only represents, quote, Christian beliefs, and is, quote, trying to impose them on the country, and that they don't care about the vulnerable and shield people who object to transgender people even existing, end quote. In the same interview, she enthusiastically agreed with the host who said that the division was, quote, an office that makes people feel like crap and is the most immoral thing that we can think of, end quote. Finally, in another tweet, she said that the work of the division was like those who, quote, stood with rapists over survivors, end quote. Mr. Secretary, do you disavow any of these outrageous statements and attacks on career professionals of the division made by Ms. Durso?
Congressman, you're presenting me something that I've never seen, and I can certainly take a look at that. But what I will tell you is that each and every person in the Department of Health and Human Services, especially in the Office of Civil Rights, has an obligation to protect the constitutional civil rights of all Americans. And we're going to do that. We're going to make sure that the work we do.
Will you commit to removing a biased ideologue like Ms. Durso from any decision-making related to the Conscience and Religious Freedom Division, since she obviously has a bias against what the division does?
So, Congressman, I look forward to working with you to take a look at some of these issues. You're presenting me something I've not heard of, and I don't, having been an attorney general for the state of California, I don't proceed based on something that I'm not aware of. We're going to make sure everyone in our department does the work that's required. And I guarantee you that the people that are right now at the Office of Civil Rights understand their obligations to protect people's civil and constitutional rights, including their conscience rights, religious freedom rights. And I think that everybody in our division at Civil Rights and within our department does exactly that. And if there isn't someone who does that, we'll get to the bottom of it.
Thank you. I yield back.
Thank you. The next is the gentleman from New York, Mr. Morelli.
Thank you very much, Mr. Chairman, for holding this important hearing. And Mr. Secretary, thank you for your service and for being here this morning. Mr. Secretary, I do want to come back to the question of surprise billing. I was one of a number of members very active in congressional efforts to pass the surprise medical billing legislation. And as the administration proceeds with implementing the law, I believe it's paramount that public comment be under consideration during the rulemaking process. And I understand the first rule, as I understand, OMB is looking at, and they're under review, the No Surprise Act. As your department works on implementing, I urge you, first of all, to remember congressional intent. I'm sure that's something you're going to do. I want to make sure that we have an independent dispute resolution process that captures the unique circumstance of each billing dispute and not hone in on a single piece of information or use that as a default, which the law did not foresee. But in addition to that, there has been some concern that the rules pertaining to the law will proceed through an expedited rulemaking process as opposed to a standard rulemaking process, which allows ample public comment. Can you give us some assurance that you will actually work on a standard rulemaking that includes public comment?
Congressman, we're committed to transparency when we do these rules. That's something that I said during my confirmation hearings. I've said it during these this testimony on our budget. Transparency is critical as we try to move through some of these rules, but we're going to work as quickly as we can because we understand how important the surprise billing law is, not just to you all, but to Americans. So we'll be there to work on it. And we're going to make sure at the end of the day, regardless of where the regs come down, that a patient is no longer on the hook for that surprise bill.
Yeah. So just to be clear, so does that mean you intend to use the standard rulemaking with public comment?
I'll have to make sure I go back to CMS to find out exactly where they are. As
Okay.
you know, we've already moved some of the proposed rules through the process here, and I'll get back to you on that.
Okay, that would be great. I appreciate it. I just wanted to shift for a moment to the question about long-term sustainability of Medicare. I grow increasingly concerned about the number of people, particularly my age, who are part of the baby boomer generation aging into the Medicare program. Early years when people enter Medicare, they tend to be lower in utilization, health relatively good. As they begin to age, utilization goes up, costs go up. And it seems to me 10, 15 years from now, baby boomers will not only represent a significant number of people in the country on Medicare, probably the greatest number that we've ever had, they'll also be at the point where utilization is higher. At the same time, if you pair that with some of the labor shortages and some of the demographics, there will be fewer people in the workforce paying into the Medicare through their participation in the Medicare rates as it relates to being paid through wages. So I wonder if you can just share with me what HHS is looking at or thinking about relative to the long-term sustainability of Medicare.
Congressman, great question, and I'll look forward to working with you all because the long-term sustainability of Medicare will be dependent on Congress passing something with the support of the administration. And there are a number of long-term solutions. What I will tell you is this: no one wants to see us damage what Medicare has meant for tens of millions of seniors who paid into the system, as you just mentioned. It has been a life-saving program for so many Americans. Before 1965, 67, when Lyndon Baines Johnson helped pass Medicare, there were too many seniors who were living in poverty. So we're going to make sure that we work with you towards solvency. That will be something we can tackle. There are any number of great ideas. And what we can do is also make sure we expand coverage under Medicare for more Americans who are reaching their senior years.
Well, I do appreciate it. I would love to work with your team on some innovative ideas around that. Quickly, and I know I'm running out of time and I don't want to impose, the 340B drug pricing program allows hospitals, I'm sure you know well about this, including 100 hospitals in my state of New York, that allows them to purchase outpatient pharmaceuticals from drug companies at a discounted rate. And they use those to provide greater access to needed drugs and more comprehensive services. Last year, I led a letter signed by the entire New York delegation on a bipartisan basis asking for flexibility for these hospitals during the pandemic. I don't know that the issue has been resolved, and I don't believe it's too late. And so can we have your commitment to work with HHS to leverage its authority to protect the 34B program, including using the 1135 waiver authority to temporarily waive the Medicare disproportionate share?
We look forward to working with you, Congressman.
Terrific. Thank you so much, Mr. Chairman. I yield back.
Thank you. The gentleman from Wisconsin, Mr. Grothman.
Thank you. Just a few questions. In your testimony, you talked about how it would be a priority, or at least you wanted to do something to stop sexual abuse, gun violence, racial inequities, drug abuse. I know we recently hit a point in which 90,000 people in a 12-month period died of illegal drug overdose. When I read about all these topics, and of course, we've had hearings here before this when I was in the state legislature on all these topics. Whenever we deal with these topics, I think part of an issue in the background is family structure. There are absolutely wonderful children raised by all families and wonderful people in all family structures. Nevertheless, there sometimes are correlations. Would you, in addressing these issues, be willing to look at family structure or see if there are correlations there that ought to be publicized?
Congressman, we have too many of our kids dying of these substance use disorders. I'm willing to look at anything with you and others that we think helps us get to a solution to keep our families alive.
If we gather information and we find out that some family structures are more beneficial than others, would you be willing to publicize that?
We're willing to look into anything, Congressman, that helps keep our families alive.
Okay. Next question. I have a bill out there in which we're trying to legalize biosimilars as insulin substitutes. Obviously, I'll be fought by the drug companies, but it results to the hundreds of thousands of families who right now are having to pay for insulin. Depending upon the quality of their insurance, some get out relatively cheaply, but some are paying, $800 or $900 a month. Would you be willing to champion the legalization of the biosimilars if it would result in a cheaper substitute to insulin products?
Congressman, I think everyone agrees that the price of insulin has just been outrageous, the way it's gone up, and we have to do something to make it so that...
I know the question for you is, because I know some companies are making money on the current system, and I'm going to need a champion to get this thing through. Would you be willing to meet with me or other representatives of the biosimilar similar group? And if it can be shown that it would probably reduce costs for these families, would you be willing to take on Congress and push a bill like that through?
I've got my team here. They've taken notes. We'll look forward to hearing from you, or we'll be in touch with you to follow up.
Okay. Well, I hope you have the guts to stand up to the special interest. Next question I have for you, inflation is just out of control. We see it on so many different commodities right now. And you're proposing a 23.5% increase in discretionary spending for HHS. Even apart from the pandemic, Congress has not exactly been frugal the last 3 years, right? But you're proposing a massive increase one more time. Could you comment on that? And does it ever concern you when you propose these big increases, and your department is one of the biggest of the bunch, that it can lead to inflation and permanently damage America economically?
Thanks, Congressman. A very important question, something that the president is also having to tackle. And that is that what we hope we can do is make sure that we're making investments through this budget, not just spending dollars, because they have to be wise allocations. We are seeing now the recovery from COVID because we made the right investments. We're beginning to see more Americans get health insurance coverage because we made the right investments in the Affordable Care Act. And we're going to continue to try to do that, whether it's on childcare, because we see how many families are in desperate need of good childcare, or whether it's trying to protect the life of a woman as she's getting ready to deliver a baby by providing better maternal health care. These are all good investments that will ultimately save us money versus just be an expenditure that goes without notice.
Well, I think there are a lot of lines in the budget when you go for 24% that are beyond investments. And I would argue that during the entire massive increase in the federal government, most people claim federal government spending is really because of investments. And now we're approaching a $30 trillion deficit. Is there anywhere in that budget that you feel 23.5% was a tight budget? That's the lowest increase you can get away with?
Congressman, we're trying to get out of this hole created by COVID. It's not done free. But I'm willing to work with you. If you think there's some, as I mentioned in my opening testimony, we're going to be very aggressive when it comes to program integrity, making sure we root out any misspending, any fraud. And so look forward to working with you. You can point out a program to me that you believe is not being well run or is making a good investment. I'm more than willing to look at it.
Thank you very much.
Thank you. The gentlelady from Pennsylvania, Ms. Wild.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being with us today. I want to personally thank you, in addition to all of the ways you've served this country, to thank you for your commitment to mental health matters, which dates back to the very earliest days of your career, I know. And before I get to my question, I just want to take an opportunity to remind folks out there who are watching that there are many resources available for people who are in distress or contemplating suicide. The National Suicide Prevention Hotline is currently always available at 800-273-8255. And I really look forward to the implementation of 988 as the new suicide prevention hotline in July 2022. I know it's been an indescribably difficult year for people in my community and across the country this past year, and our kids are hurting, people are hurting. A new study just confirmed that suicide attempts among girls have increased dramatically, with emergency rooms now reporting 39% more suicide attempts for girls aged 12 to 17 in the winter of 2021 compared to 2019. Your department is a very important piece of the suicide prevention safety net, but it's only one piece. Some partners who we would expect to be helping are our large companies, including YouTube. You will see behind me this rather large poster of a YouTube, that it's a screenshot from YouTube that we took that represents, believe it or not, the beginning of a video on how to tie a noose. And we've been in contact with YouTube. I've been pushing them for months to step up their suicide prevention work and finally remove instructional videos on how to tie a noose. As you see, it says, I hope you can see it, it says how to tie a noose, easy steps to the perfect hangman's noose. It's got 1.3 million views, and then it goes on multiple pages of how to perfect a noose. Imagine that. We need to meet and find people where they are. And all too often our young people are, for better or worse, looking for answers on places like YouTube. Secretary Becerra, my question to you is, are you willing to work with me to convene a meeting with YouTube and experts in suicide prevention to get this addressed?
Congresswoman, first, thank you for the work that you're doing on this crucial subject, because I mean, life is, it's tough to lose any life, but a young life, worse. And so I would look forward to working with you and your staff, any ways that you think we can try to address this, the suicide issue with teens and just the mental health issues that we know are cropping up as a result of COVID-19. So please count us in any of the efforts you're looking to undertake to try to help address this. We have resources. Thank you, by the way, for what you did with the American Rescue Plan. We're going to do what we can, and we look forward to working with you.
Thank you so much. And believe me, we will be reaching out. We've made some progress with YouTube, but not nearly enough. And I think it's going to take the weight of your office to get us to where we need to be with them. Now, I want to just take a step back in my remaining time and ask you, do you believe that your department has sufficient resources to prioritize suicide prevention? What's been promising, what needs scaling up, and how can we help here in Congress?
Well, that's a mouthful of a question, Congresswoman, because we actually have more resources now than we've had in quite some time because of the work you did on the American Rescue Plan. If you help us get that American Families Plan that the president has proposed through, we'll have more resources as well. But as you know, we've been so far behind. Even on 988, the resources that we have, that we're putting into it, this has to be a nationwide effort, and it's going to be tough to scale up to make sure that 988 is available to anyone who needs to call. And so it's great that we have more resources. Going back to the previous conversation I had with the congressman about how we're investing our money and can we do with less? You know, we don't have enough right now, and you know this, to deal with the mental health issues that we're confronting, the substance use disorder issues that we're confronting. We need those dollars, and the budget reflects President's commitment to invest to keep Americans safe and healthy.
Thank you so much, Mr. Secretary. I look forward to working with you on this very important issue, and I do believe it should be a bipartisan priority. So thank you.
Thank you. Our next Mr. Secretary, our next questioner is a surgeon from North Carolina, Dr. Murphy.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, appearing before the committee. I'm going to start a theme that have others spoken about. I'm a physician. We've done a great job of vaccinating. We're now meeting in the chambers without masks. This particular venue on how to conduct committee business, and I know it's going on in other committees too, is simply ridiculous, and it's not doing the work of the people appropriately. So I'm hopeful that we'll actually get back to seeing people in person and doing the work in the manner that we should that's most effective. Mr. Secretary, the use of telehealth. I will tell you, I worked on telehealth for quite a while when I was working in our state's General Assembly, and unfortunately got blocked by a lot of insurance companies. And one of the great things that the Trump administration did was release the regulations on telehealth. It makes a difference. I practice, I actually still practice in a very rural part of Eastern North Carolina, and telehealth has made a game-changing difference in people being able to access healthcare. I'd just like to ask for your support in making the telehealth accepted benefit permanent. So I'd like you to comment just on that, that you'll continue what was a silver lining in this pandemic and allow American people to be able to access telehealth.
Congressman, thanks for the question. Crucial. We learned a lot from COVID. Telehealth has been indispensable. Look forward to working with you. We'll do what we can through regulations with the discretion we have, but we'll probably need your help to make sure we can fully implement the new, moving forward, the new opportunities that telehealth is making available. We have to make sure as well that we provide broadband to all communities so that no one is left out. But look forward to working with you, because Congress and the administration can make a great deal of movement forward on telehealth.
Great, great. Also, Bobby noted that I'm a surgeon. I'm a urologist. I deal with diseases in the male and female genital urinary tract. So I've done a lot with fertility and those type of things. And so I still, to be very honest with you, I have to scratch my head, and I'm losing more hair as we go, about this mother-father thing. Can you give me an instance where I should call someone a birthing person who is not a mother? In other words, should I now call my mom my birthing person? What is this nonsense? What give me an instance where this is appropriate?
Congressman, thanks for letting me respond. And I'm not going to make a mountain out of a molehill. What we're talking about is making sure we use language that's inclusive, that is accurate. And if you wish to call your mom mom, as I call my mom mom, go right to it. But for some people, they'd like to make sure that they are accurately represented when we refer to them. And we just want to be inclusive. That's all it is. People can make more of it, but there's nothing more. You can send your Mother's Day card to your mother, as I sent to my mother. Nothing changes.
Yeah, I don't get it. I know a lot of genealogy. I work with X and Y chromosomes and all these other things. I just don't understand that. I mean, what should I call my dad?
Well, let me put it this way. There was a time when my dad saw language that said no dogs or Mexicans allowed. And so he couldn't walk into an establishment when he was a young man, even though he was a US citizen. Words have meaning, and we try to be accurate. And we want to make sure that just as we allow anyone to walk into an establishment, we want people to understand that when we talk about a program, it refers to everybody. And if you prefer to be referred to as a birthing individual, so be it. We're not harming anybody.
Yeah. Well, all right. Thank you. That baffles me. I can't, I'm not going to be, anyway, it just makes no sense to me. It's been 84 days since Vice President Kamala Harris was appointed as the border czar. 84 days, and she's not visited the border. Do you brief her on what's going on at the border? Or have you asked her to visit the border?
We are fortunate to have an opportunity to brief the administration, the White House, the president and the vice president periodically, certainly on the affairs that deal with Health and Human Services. And we know that the president and the vice president are very engaged on this. The vice president just came back from a trip to Central America and Mexico, where she was trying to help us address these immigration challenges. And I know that they are on a day-to-day basis receiving briefings, not just from us, but from the Department of Homeland Security and others when it comes to these issues involving immigration.
All right, let me just throw one other thing. We were just talking about overdoses and drugs, a subject that's very dear to my heart. I worked a lot on the opioid epidemic. Because of the crisis that the Biden and Harris administration has created, where the flood of drugs, illicit drugs, are now coming into our border, how do you see us being able to push that backwards? Because we're going to see a massive increase in the number of overdoses.
Congress, first, it's not going to surprise you that I don't agree with your characterization. And two, I think this administration is doing more to keep drugs out of the hands of individuals and for those who are already drug addicted to try to help them recover. And so I hope that we're able to, with your support, continue in that course.
Thank you, Mr. Chairman. I'll yield back.
Thank you. The gentlelady from Georgia, Ms. Macbeth.
Thank you, Mr. Chairman, for convening this hearing today. And thank you so much, Secretary Becerra, for your continued service to our country and just your commitment is just definitely without reason. We definitely know that you truly care about the health and welfare of Americans. But during this pandemic, with many families sheltering at home, we've seen an unfortunate rise in cases of domestic and family violence. It's now time more than ever, I believe, to really work on securing the funding for protecting these survivors and their children. I've seen too many families in my own home state of Georgia, which I represent, they're suffering at the hands of domestic and family violence. And I just know we've got to protect these families and families all across the nation. That's why I'm proud to have reintroduced the bipartisan legislation that reauthorizes and expands the necessary funding of programs focused on helping survivors of domestic and family violence, FIPSA. And this legislation we know would provide survivors the resources that they need to rebuild again and to keep their children safe. And mind you, this was legislation that was here even before I came to Congress in 2018. But as you know, the committee recently held a hearing on FIPSA and is currently working on tweaking the reauthorizing of this legislation. And we're also providing, we've also provided $450 million in emergency supplemental funding in the American Rescue Plan to support the survivors of intimate partner violence, especially under COVID-19. But Secretary Becerra, can you provide an update for us on the distribution of these American Rescue Plan Act funds to communities? And also, are people getting the help that's been mandated by this legislation that we passed?
Congresswoman, thank you for the question. Yeah, can I just say thank you, Congresswoman McBath, for your commitment to this and your just tenacious, dogged persistence on this, because it is worse than people think. We just don't see it because it's taking place at home, right? And so thank you for protecting those family members who are victims of some of the worst violence we can ever experience and having it done by someone you thought you loved or loves you. We are making a commitment to try to spend that money locally the way the locals believe it can best be spent. And so the more than $200 million that we put into FIPSA in this budget would help locals make those decisions, building on what we've learned since COVID. At the same time, you're probably familiar with the program that we're calling for under CDC, the Community-Based Violence Intervention Initiative. That's to help prevent these things from ever occurring. And so working with champions like you and folks back home who understand this issue, what we hope is we can make a dent in this and make a big difference in the lives of some of these family members and get them the help they need to prevent it from occurring. Because the most important thing is to keep family units together if possible, but one way or the other, protect members in a family.
Right. Well, thank you for that. And, as we're moving forward with this reauthorization, and as you said, absolutely, I am doggedly pursuing this because I've been watching under COVID, just the percentages and the statistics go up with women that have been abused by their domestic partners through the use of guns. What are your top priorities for this legislation?
Well, we'd like to do our part on gun violence prevention. The research that we can do, because this is a health crisis. It's not just a gun violence crisis, it's a health crisis. And if we can add the data that helps us understand how to address this, how to prevent it, that'll take us a long ways. We're going to continue to work with those who want to try to help those family units, whatever shape they take, to protect those domestic partners as best we can. But we understand that there are a lot of professionals who've been doing this for a while in those communities. And we should try to work with them because they know how to do it best to tailor programs for that community. What may work in California may not work in another state.
You're absolutely right. And I'm just really glad with the, reauthorization and appropriated, additional funding. It's really going to reach different demographics of individuals that were not included in this appropriated funding before, such as our Native American population. So I'm really looking forward to being able to really continue to champion, and anything that you need from me, my staff, anything that you need from us, please don't hesitate to call on us, because we're really going to continue to doggedly pursue this for the sake of making sure that our families are safe and healthy. Thank you.
Georgia's got a great champion in Congress, so thank you.
Thank you very much. I yield back the balance of my time.
Thank you. Gentlelady from Iowa, Ms. Miller Meeks.
Thank you, Chairman Scott and Secretary Becerra. Before I begin my questions, I want to thank you for the guidance that HHS recently issued, granting more flexibility for the provider relief funds. I wrote a letter to you with my colleague, Representative Axney, asking the department to issue this type of guidance. And this much needed flexibility will allow providers to fully use the provider relief funds as they continue to recover from the impact of the COVID-19 pandemic. So thank you in the department for the guidance update. Also, Secretary Becerra, on May 6th, also Dr. colleague, Dr. Murphy, who you recently heard from, and myself, wrote to the CDC Director Walensky asking questions about the troubling information that had come to light with respect to the role the teachers' unions had played in altering the CDC's school reopening guidance. A response to that letter was requested by May 20th, but we have still not received a response a month later. Mr. Secretary, can you tell me what the Biden administration is worried about revealing, and will you commit to us to get us a response to that letter within the next week?
Congress, we absolutely commit to get you a response as quickly as we can. We'll work with you. If we'll try to make sure we keep your team updated on where we are. A critical question. All of us, whether it's our teachers or whether it's our children in school, and certainly the families who will see these kids come back home after being in school, we all want to make sure we're protected and don't see COVID flare up again. So we'll try to get back to you as quickly as we can. By the way, thank you for your work on the Provider Relief Fund, because we listened to a lot of your all comments in making sure we came out with a guidance that would be helpful in regulations.
Thank you again for that. And given the number of children that have committed suicide while schools are closed, I think it's extraordinarily important that we actually are listening to the science rather than the teachers' union. And that's particularly troubling in light of the public testimony Dr. Walensky gave subsequent to our letter. She testified that teachers' union input on guidance was limited to, quote, "What happens if you have immunocompromised teachers?" Close quote. However, the emails uncovered showed that the union's influence went well beyond that issue. And so if you can explain, if necessary, and correct the inconsistencies between the testimony of your CDC director and the CDC emails.
Congressman, I can tell you, knowing Dr. Walensky, that she and her team at CDC used the agency is critical, and they make sure that they use all the science they have before them to make the decisions for the CDC. That's one of the reasons why I think we're able to come out of COVID, because CDC has based its actions on the facts and science before it to guide America and how we move forward.
And given how critical the CDC is, of the additional 1.6 billion budget increase for the CDC, can you commit that a significant portion of that will be directed directly to non-competitive local public health care grants, so our local public health officials get the assistance they need after having worked 24/7 through a pandemic?
I commit to work with you. I don't want to commit anything in terms of CDC's allocations, because I obviously would want to talk to Dr. Walensky about that and her team, but we can commit to you that we'll do it in a transparent way so you and others can see exactly how we are allocating those resources.
Thank you. There were also troubling reports earlier this year that the HHS was placing unaccompanied alien children with sponsors in the US before background checks were completed. Today, are all sponsors of unaccompanied minors, unaccompanied children receiving background checks prior to placing a child?
Congresswoman, I want to guarantee you that under my watch, and certainly under President Biden's watch, every child who is discharged to a custodian, a responsible sponsor, has had that background check done before we release that child.
Thank you. The AP reported in March that the Biden administration was waiving FBI fingerprint and background checks for staff and volunteers at temporary influx facilities who directly care for children. Today, are all caregivers at temporary influx facilities being fingerprinted and getting background checks prior to working with children?
Anyone, Congresswoman, here I can assure you again, anyone who works for the Department of Health and Human Services, and especially with regard to the care of the unaccompanied migrant children, goes through all the appropriate and legally required checks before we allow them to work with us. We have different categories of workers, obviously, some who have direct care services, some who provide the oversight of the discharge process and the review of files. But we make sure that anyone at HHS or who's employed by HHS has gone through the appropriate checks before they can be employed.
So you would agree that a lack of background checks on caregivers and a lack of fingerprinting increases the risk of physical and sexual abuse of children at the border, and having unaccompanied minors dropped off at the border does increase their risk of human and sexual trafficking.
We are not going to do anything that imperils the safety of a child. And I think, at least in the few months that I've been secretary, I think we've proven that we are doing this in a way that not only protects the rights of these kids, but respects their rights as well.
Well, thank you so much for answering my questions. And I would also encourage you to visit the border, and I yield back my time.
Thank you. We will have a 5-minute break after the next questioner, and then come right back to either Mr. Owens or Mr. Good if Mr. Owens is not available. Gentlelady from Connecticut, Ms. Hayes, and then we'll take a break.
Thank you, Mr. Chair. And thank you, Mr. Secretary, for being here today. Before I start my statement, I just want to, I've heard a lot of concerns about the input of teachers' unions and school reopenings. We had a conversation with the leaders of both of the largest teachers' union in the country, and they are both committed to doing everything that they can to have full-time in-person reopening in September. So that is what they are looking for as well. So just something to note here. Mr. Secretary, yesterday I introduced a bill, HR 3904, Reducing COVID-19 Disparities by Investing in Public Health Act, which responds to the disparities that have emerged in COVID-19 hospitalizations and deaths by tackling the underlying chronic problems, disparities in public health and chronic disease prevention and treatment. I want to first thank you for the over $261 million increase to the National Institute on Minority Health and Health Disparities in the proposed budget. The COVID-19 pandemic has revealed that we need to do more to combat systemic inequities that have left communities of color more vulnerable in our healthcare system. There are significant racial disparities in the rates by which Americans suffer from chronic diseases like heart disease, diabetes, and asthma. African-American children are 12% more likely to suffer from childhood asthma. African-Americans are 30% more likely to die of heart disease and twice as likely to have a stroke. Additionally, African-Americans made up 22% of COVID-19 deaths. So I was a little disappointed to see that this budget included just a negligible increase for the Chronic Disease Prevention and Health Promotion Fund at CDC. The American Heart Association and the American Lung Association recommended that this fund be increased threefold. So having seen the impacts of these chronic underlying conditions and the need for increased funding, when I saw that the Office of Minority Health was flat funded in fiscal year 2022, I was, to say the least, disappointed. Can you talk a little bit about how important funding for these areas are and what efforts your department will make to increase fundings to combat chronic diseases and the corresponding disparities that accompany them?
Congresswoman, thank you for the question, and thank you for being a champion of eliminating those health disparities. One of the pillars of, at least under my administration at HHS, will be equity. I've made that clear to all of those lieutenants within this agency, and it's a large agency, as you know. I am reflecting the commitment that President Biden has made to move forward on equity. And what I can tell you is in the investments we're making, whether it's on minority health, where we are investing some $250 million in the National Institute of Minority Health and Health Disparities, or whether it's the issue of maternal health, where we're investing several million dollars, excuse me, to try to address the disparities that we see in outcomes for women in maternal health. That's all to make sure excuse me, that's all to make sure that we address these disparities that have existed for far too long. And so what I can tell you is that we're committed. You may not see it in the line item in the budget, but we are absolutely committed to making progress in addressing these disparities. I wouldn't be in this position if that weren't the case.
Well, thank you. I appreciate that. And I'm glad to hear that, because this isn't about feelings of a particular community. The data has shown us, and the disparities that were revealed during COVID has shown us that there are huge equity gaps that need to be addressed in our systems, in our processes, and our functions. What can we in Congress do to help support your department in securing funding or even promoting these efforts? Did I lose you?
Mr. Secretary, I think you inadvertently muted yourself.
Yes, I did. I was when I was drinking water. Congresswoman, what I was saying is, first, the most important thing you do is keep tenaciously testing the Secretary of Health and Human Services to make sure that we do address these disparities. I hope you will keep coming at me and saying, Secretary, show me what you've done. And I guarantee you that if I'm worth my weight in salt, I will have done what you would like to see, and that is to address these things. In the fibers in my being, my DNA is all about making sure we address these disparities. So keep me to task.
I can absolutely commit to doing that. Thank you, Mr. Secretary. With that, Mr. Chair, I yield back.
Thank you. And now we'll take a 5-minute break. And as soon as the Secretary comes back, we'll reconvene with either Mr. Owens, if he's available, or Mr. Good would be next if he's not available. A 5-minute break. Come back to order. And the next person is Mr. Owens on screen. I don't see him. My distinguished colleague from Virginia, Mr. Good.
Good afternoon, sir. Thank you, Chairman, and thank you, Secretary Becerra, for being with us today. And I appreciate the opportunity to talk with you. Secretary, I'd like to discuss how your department is handling the thousands of unaccompanied migrant children who are illegally entering our country. It's been disheartening to see President Biden reverse policies that would mitigate the crisis at the border, such as the MPP or Migrant Protection Protocols, commonly referred to as Remain in Mexico, and that Vice President Harris has yet to visit the border, as others have noted, even though the president has named her as our border czar. With responsibility for the well-being of thousands of children falling under your jurisdiction, I'm sure you're extremely disappointed and frustrated with the refusal of your superiors to control the situation at our southern border as you struggle to deal with and try to clean up the mess they're making of our border and our immigration policies. Secretary Becerra, do you think it would be helpful if the president were to visit the border to see firsthand the crisis he has exacerbated and continues to create there at the border?
Congressman, thank you for the question. And it's crucial. This is an important one. I think the president and the vice president are committed to making sure that we take on this challenge that immigration presents. He did present early on a proposal to Congress to try to reform a broken immigration system. This is what happens when you have a broken immigration system, right? For our purposes, we have to take care of quite a number of kids who've come across without any adult with them. And it's a tough issue, but I guarantee you that the president is committed, along with the vice president, to tackle this as best we can, and hopefully Congress will take up immigration reform.
So you don't think it would be helpful for him to actually visit and to send a message that he's engaged, or for him to even know what you're dealing with firsthand by going to the border? You don't think it would be helpful for the president to come?
Well, he and his team, and that includes me, have been very engaged on issues.
I just want to know if you don't think it would be helpful for him to come.
I think the president has been on top of all of these issues through his.
Okay, so let me move on, please, because I want to know if you think it'd be helpful for him to be there himself. How about the border czar? Do you think it would be helpful to you if she were to visit to get a better sense what needs to be done?
Well, the vice president had already shown her commitment to this issue. She just recently returned from a trip to Mexico.
I'm referring to our border. I think she was a little confused. We don't need her to go to Europe's borders, but to go to our border. Do you think it would be helpful for her to come to our border?
I think it's important to have the top two leaders of our nation engaged, and they are both engaged.
Okay, I agree with
their
that.
Team.
How about yourself? Have you yet, since you've become secretary, or do you plan to visit the border?
Congressman, I've been to the border so many times over the course of my life and in my career, and I certainly have been there as Secretary of Health and Human Services.
So I'm sorry, when were you last at the border?
I was there about 2 or 3 weeks ago when I visited one of our sites there in the El Paso area.
Well, and I'm sure that you would say that it's been helpful to see how much worse it has become during this administration and to see it up firsthand. The world is watching and observing the utter chaos and the lawlessness that's become the disaster at our border, yet it doesn't seem to be sufficient urgency from this administration to address the problem. Do you have any sense of when, if ever, this administration might gain operational control of our border?
Congressman, look, we are not separating kids from their parents. We are not seeing people die in the hands of federal government officials. I will tell you that what the Biden administration has done is handled this in a lawful manner. It is a challenge, but I respect that we have a president who's willing to treat people as human beings and is respecting of the law.
Well, I think we are facilitating the separation of children from their parents the way that we are encouraging illegals to stream across the border, that we're allowing unaccompanied children to come across, and we're trying to help and facilitate that versus preventing it. The previous administration's work to secure the border looks more impressive with each passing day as we see the crime and the drugs and the suffering victims, including the children that are streaming across the border. It does seem to be that there's been disagreement within even this administration, though, on how to handle it. And as I run short on time, I want to reference the article which, Mr. Chairman, I'd like to submit for the record, please. This article a political article from last month that was titled "Becerra's Cautious Border Play Rankles the White House." It seems as if you were in favor of the refugee caps of the 15,000 before the administration reversed it to 62,000. Do you see any operational reason or any benefit to go to the 62,000 instead of 15,000?
First, Congressman, that article is inaccurate. And secondly, I believe we're going to handle the influx of refugees as they come. The president is committed to make sure that we do our part as a world partner to make sure that people who are seeking to escape persecution and death have a place that they can go. And America has always been a shining light in that regard.
Thank you, sir. My time has expired. Such, Mr. Chairman, I yield back. Thank you.
Okay, without objection, the article will be submitted to the record.
Thank you, sir.
Is Mr. DeSaulnier ready to respond to ask questions? The gentleman from California, Mr. DeSaulnier.
Thank you, Mr. Chairman. Mr. Secretary, it's such a pleasure to see you. Always proud to
Lunch or something at some point.
Sure.
Maybe change your mind a bit.
anytime. I know who'll end up paying. You're smarter than
I gotta make sure I follow the ethics rules.
Ditto.
Sounds like Dutch Street to me.
Actually, Mr. Chairman, we were going to invite you so we could have someone who could pay. Got real money.
Like I said, sounds like Dutch Street to me.
He should pay. He went to the Stanford.
Okay, we're back. We're back live.
Okay. Well, let me finish that thought. So behavioral health, particularly emphasis on kids, we've got, I think in a lot of ways, a good thing, and the stigma has fallen apart dramatically. So Americans are seeking out behavioral health services, but we don't have as many people going in to the profession. So we've got this supply and demand problem. I wonder if you could tell me, and I'd love to work with you on this, is how do we address this? We've got this great policy in the ACA that allows for parity. We've got some challenges around that the committee and the subcommittee are working on, but we need to get more infrastructure. We need to get more providers. And of course, the expertise and the knowledge on neuroscience and how the brain works to stress is growing exponentially. And with a particularly emphasis on kids. We know that there's a lot of emerging research about COVID and the impact on kids. So how do we work together with you and your department to meet the needs for people, particularly young people, around behavioral health as we come out of COVID?
Congressman, thanks for the question and the sincere way you posed it. Look, at the end of the day, we got to put our money where our mouth is. And we've always talked about making mental health, putting it at parity with the way we treat physical health. And we've never done that. And fortunately, you all did us a great service in the CARES Act and then, of course, in the American Rescue Plan, and actually providing real dollars to try to tackle this. We just put out about a month ago a $3 billion lead of money, half of it for mental health, half of it for substance use disorders. That's real money that hits the ground in these communities where you are, where I am. We have to do more of that. This budget that the president presents provides over $1.5 billion for the Community Mental Health Services Block Grant to go even further. We hope that you'll help us through the American Family Plan to make these investments. But at the end of the day, as you and I know, it's whether we're willing to put our money where our mouth is to make this happen. And fortunately today, more and more, we're willing to say that there's a family member who needs mental health services.
Great. I look forward to working with you. The plague that is gun violence in the United States, very difficult issue for the Congress, very partisan. I wonder if there's a possibility in the department, and I really feel strongly and have for a long time, that this is a public health issue. And if we look at it analytically, respect the Second Amendment, respect we have differences of opinion, and my comments don't de-emphasize the importance of the urgency as every day goes by. But maybe a little longer view is, now that we've got CDC with some funding, at least for research, could we look at a longer view and hopefully address the urgency of this, but just gun safety? Surely we could all agree that evidence-based research on gun safety with recommendations to Congress and the administration to enact gun safety policies could be something we could all focus on and agree to. I wonder if you could comment on that and how much discretion you might have to actually pursue that within the department.
Congressman, you and I come from a state where treating gun violence as a healthcare problem, as a public health crisis, is not new. And fortunately, President Biden has recognized that we have to do more. We're going to expand research. If you help us with our budget request, we'll be able to expand our research to help other states beyond California. But at the end of the day, we have to recognize that this is a crisis. It's a healthcare crisis, not just a gun violence crisis. And the quicker we do that, the more lives, especially young lives, that we'll save. So look forward to working with you on that.
Yeah, just because it's personal to me, I always remind people that of the over 100 people who die of gun violence every day in the country, 2/3 of them are suicide. And that far outstrips the second causes of suicide in the United States. We know that proximity to guns accelerates the success of people committing suicide. I really look forward to working with you, Mr. Secretary, on both the subjects and really important work we have to do. And again, I'm so proud of you. Even though you went to that school.
Gentleman's time has expired.
I yield back. Thank you.
The gentleman from Utah, Mr. Owens.
Secretary, we've had a series of hearings in recent months looking over the impact of COVID-19 on different student populations. Republicans have invited parents to those hearings to talk about the negative impact on school closures on their children and families. Two of those parents have explicitly said that one of the lessons our nation should learn from this pandemic is that schools are essential services and should never, ever be closed for an extended period of time. Do you agree that we should resolve as a nation to never close our schools indefinitely, as so many school districts have done this year?
Congressman, thank you for the question. I would agree that we should never have to close our schools. We should always do what we can to prevent the need to keep a child from going to a school. And that's why we're trying to prepare for any pandemic in the future, and COVID is going to teach us a whole lot.
Okay. President Biden's 2022 budget requests enormous increases of in early childhood care and education programs for both new and existing programs. For early education, that includes about $200 billion to impose a universal preschool program for all third and fourth grade children. I'm sorry, 3 and 4-year-old children, as well as a $11.9 billion for Head Start program, which is increased over $1.2 billion since 2021. The proposed universal preschool and existing Head Start program are largely duplicative in early education programs. How do you see these two competing programs coexisting, and what studies have you done to understand how this proposal will impact the existing small businesses already serving these children?
Congressman, first, there is no conflict. They will work in concert to make sure that families have the resources they need to make sure that they not only have childcare services available, but it's quality childcare services. We are so far behind in making that available. I mean, we are the greatest democracy, richest democracy in the world, but we seem to be about the only industrialized nation that doesn't realize or figure out a way to actually make sure that parents can go to work and not fear what's going to happen to their kids during their work hours. We can make these investments and make it work for everyone. And we're not, I guarantee you, this is not a dollar wasted when you help a family provide quality childcare for their kids.
Since the outbreak of the pandemic, an astounding amount of federal funding has been put into early care and educational system, including $40 billion in American Rescue Plan Act alone. This act excluded all Republican input and reflects poor policymaking, especially with respect to accountability. On April 14th, the committee sent a letter to you asking for important information about the oversight of this unprecedented influx of new federal child care funds. Sadly, we have not received a response. With respect to the $50 billion in the ARP for child care, how are you working to ensure the funds are spent responsibly and to avoid a funding cliff for child care providers and to support long-term solutions for families' child care needs?
Congressman, let me invite you and your team, if you'd like, to work with us as we implement some of the programs under the American Rescue Plan. As I mentioned to you, and I said in my opening statement, transparency is going to be a big deal for us. We want to make sure that we demonstrate the program integrity so that we make the right use of these dollars that you've made available to us. We thank you for making those dollars available to us so we can actually help families provide the child care that they need for their kids. And when we do a program, if you have any questions, we're going to make ourselves available. So please feel free anytime early before we start implementing or during its implementation to ask us any questions you have.
Thank you, Secretary. I yield back.
Thank you. The gentleman from Michigan, Mr. Levin.
Thank you so much, Mr. Chairman. It's so great to see you. An honor to call you Secretary Becerra. Thanks for appearing before us today. I'm going to try to shoehorn in two sets of questions, one about the ACA and one about care workers. So let's see if we can do it. As you know, there's a lawsuit brought by Republicans, California versus Texas, which threatens the future of the Affordable Care Act. In fact, I think you rallied states in defense of the ACA in your former role as California's Attorney General. I applaud the Biden administration for reversing the position taken by the previous administration, which supported partisan attorneys general who argued that the law should be struck down. But the threat of this lawsuit is still there. A decision by the Supreme Court could be handed down any day. So would you explain what this means for my constituents? Which parts of the ACA are at risk if this Republican lawsuit were to prevail? What kind of chaos could result if the Republican attorneys general succeed, and what would happen to the existing insurance market? How many people do you think might be harmed as a result? Give us your sense.
Congressman, first, great to see you, and please pass along my best regards to former Congressman Levin as well.
You know I will.
Absolutely. Please give him a big hug.
He is so proud of you, sir.
He's an important mentor in my life, and someone who really taught me some real values and how you can exercise those in Congress. The ACA, we're going to find out real soon. It's in the hands of nine individuals, 9 Americans. And if they choose to find it constitutional, as they have in the past, then we're going to be able to grow that number from 31 million Americans who have good health insurance coverage as a result of the Affordable Care Act to even more. If they somehow, for some reason, decide that it is not constitutional, well, then you all have some really important work to do, and so do we, to try to somehow protect all those Americans who don't have to worry about having a pre-existing condition, and as all of a sudden, now they're going to suffer and face the consequences they had in the past, where you could be discriminated against in getting insurance coverage simply because you have asthma or you have some other type of pre-existing condition. All those kids who are under the age of 26 who have health coverage through their parents' policy will all of a sudden find that if you're 18 to 26, you're out of luck, and those parents will no longer be able to provide them coverage. Those seniors who have preventative healthcare services and help paying for their prescription medication will find they're out of luck if the Affordable Care Act goes away. All of those things disappear if somehow a majority of those 9 justices believe that the Affordable Care Act is unconstitutional. But Congressman, having been the Attorney General who got to have his team argue that case before the Supreme Court, I can't tell you I'm totally confident, but I actually believe, I have a great deal of confidence that the Supreme Court, those justices will find their way to do the right thing for America and protect the Constitution and its values by protecting the Affordable Care Act. That's my hope. We'll see.
Thanks. I hope you're right, for sure. And you know, I'm a former union organizer. My first job in that space was helping nursing home workers organize with SEIU, I think almost 40 years ago, but we won't dwell on the passage of time. Making sure the direct care workforce has a safe workplace, a living wage, and great benefits is a cause near and dear to my own heart, and I know it is to yours. And I know from my firsthand experience that this critical workforce is made up largely of women of color and immigrants who are paid on average about $12 an hour. So, Mr. Secretary, how will HHS partner with the Department of Labor and us to invest in the direct care workforce? And how will you do it in a way that improves worker recruitment, retention, development, and make sure that they're paid well and protected in their workplaces?
Congressman, critical, because it's hard to believe that we don't want to pay people who care for our dearest loved ones in the right way. And that's why the president's budget places true value in supporting those caregivers. We're requesting $73 million in increase for a total of $280 million to provide support for the National Family Caregivers and Native American caregiver support programs that are out there helping caregivers. We want to continue to see those Americans who take on the tough task of caring for our family members receive the wages they deserve. And we are looking forward to working with you to pass the American Families Plan that gives us an opportunity to invest further in caregiving for whether it's our grandmother or our child, making sure that we do it the right way, paying real wages.
Thank you so much, sir. We're here to work with you. And Mr. Chairman, I yield back.
Thank you. The gentlelady from Michigan, Ms. McLean.
Hey, thank you very much, Mr. Secretary. I want to thank you for being here today. I just have a few questions. First, would you agree that obviously the health and safety of our citizens remains the utmost priority?
Absolutely.
Okay. And I've listened to the testimony. You stand behind the FY22 budget request of $131 billion for HHS, even though it's a 23% increase, correct?
That budget we have put forward, having gone through all the elements of it, and hope that you'll support it.
Okay. And do you commit to ensuring, it seems like you've said this, but to ensuring a transparent and responsible use of taxpayer dollars?
Of course.
Thank you. So I'm glad that you agree with me on the basics. And I believe that there is a crisis. You testified that you agreed with me, there's a crisis. I'm curious to know a pandemic crisis. Do you feel that we're coming out of the COVID pandemic crisis?
The president, his efforts to get so many millions of Americans vaccinated, his ambitious goal to get 70% of adults with at least one shot in arm by July 4th, all of those efforts, his investments in the American Rescue Plan and the support of Congress to pass it, all of those efforts have led us to the point where, well, you're now beginning to see some states open up. And so we're not out of the woods, but we are certainly in a far better place than we were a year ago.
Do you believe we have a crisis at the border?
We are certainly facing the challenges that come from having a broken immigration system. And I have to deal with those in one aspect when it comes to those unaccompanied migrant children. But without a doubt, for decades, having a system, an immigration system that's broken, creates these kinds of challenges.
So that's a yes, we do have a crisis at the border. I'm confused with the answer, sorry.
Well, we have a broken immigration system that is creating all of these challenges that we must face. It's not just this administration, previous administrations. I remember when I was a member of Congress.
Agreed. As we sit here today, I think we have a crisis at the border. We have a broken immigration system as well. So I'm just, are we in agreement, or do you think we don't have an issue at the border?
Well, I'm glad you agree that we have a broken immigration system. It definitely creates these challenges that while we're taking them on, it makes it tough. And I hope that you all will take on the president's proposal for immigration reform.
I don't know why it's a struggle to answer the question about a crisis at the border, but I'll take it as a non-answer, I guess. Where my confusion comes in is you've diverted $2 billion of funding to deal with the crisis, non-crisis, I don't pick whatever word you want, you know, 850 million from the stockpile money, as well as 850 million of COVID testing money. So can you see my confusion is, if we don't have a crisis at the border, why are you diverting funds from COVID and from our stockpile that would help us deal with the COVID crisis we have now or a future pandemic? So I'm very confused. If we have a non-border crisis, why we're diverting $2 million.
Congresswoman, thank you for the question. And I've tried to explain this in the past. We have an obligation under the law to provide care for these unaccompanied minor children, regardless of what their ultimate outcome will be, if they have to return back to the home country or not. While they're here temporarily, it's our obligation to make sure they are safe and healthy.
And that obligation comes at a cost, because for every action, there's a cost, right?
Well, there's certainly a financial cost to it, no doubt. But we're going to do it right, because no child should be, we should not cut corners simply because the child may not be someone we know or have had in this country for a long time.
But it's coming at a cost to our non-crisis at the border. So if we don't have a crisis at the border, why would we need to divert $2 billion to take care of that non-crisis?
So Congresswoman, we're handling the challenge that the unaccompanied children present. At the same time, we're making sure we're making use of those dollars to pay for those services in the ways that you all have in Congress provided to us. So all the monies that we use lawfully and transparently. That's why you're able to cite certain figures.
Okay, so we are going to continue. Do you see more money being diverted to this issue in the future?
Congresswoman, until you all fix this broken immigration system, we're going to continue to face challenges like this. And I have, under law, the obligation to make sure I care for these kids. Until you all deal with the crisis, the critical aspects of immigration, the way they should be dealt with, this broken immigration system is going to continue to create these challenges.
And we can start by limiting the number that come in. But with that, I'm out of time. Thank you, sir, for your time. I appreciate it, and I yield back.
Thank you.
Thank you. The gentlelady from Michigan.
Thank you, Mr. Chair. Can you hear me all right?
We can.
Okay, great. The other gentlelady from Michigan, representing from Troy to down over to Canton. And thank you, Mr. Secretary, for your testimony today, which was very well written and put together, and your answers to today's questions have been tremendous. I've been seeing that there's a lot of emphasis on immigration, and we've got a large committee here today, but it's interesting because our jurisdiction and Ed and Labor is pretty specific for why you are here. And the last time I checked, there's certainly a lot that we should be discussing within our jurisdiction. And that's exactly what I wanted to talk to you about, Mr. Secretary, which is our older Americans who have been so hard hit by this pandemic. While the need has been growing for years, the pandemic has caused an unprecedented increase in demand from older Americans for meals and other critical Older Americans Act services that help them stay safe and well in their homes. I know I frequently participate in the Meals on Wheels program that operates in Waterford, Michigan. And so though we see ourselves defeating this virus and making lots of progress in the pandemic, the needs for programs like these are likely to remain. So just wanted to hear from you, Mr. Secretary, about your plans to continue to serve older adults who now rely on OAA services as federal COVID stimulus programs begin to wind down. Thank you.
Congresswoman, thank you for the question. Critical. You may be aware that in May, early May, the Administration for Community Living within the Health and Human Services Department released about $1.5 billion in funding to states and territories. And that was money that we thank you for because it came from the American Rescue Plan. And that was for our Older American Act programs. Those dollars are going to help fund vaccine outreach and coordination to help address social isolation that too many of our seniors are experiencing, to provide family caregiver support, and to offer nutrition support for our seniors.
Right. And Secretary Becerra, we know that the pandemic has also had a severe impact on the mental health of young Americans. That's come up in today's hearing. And according to the American Academy of Pediatrics, over 40,000 children have lost a parent to COVID-19. Has HHS begun to collect data on children and teens affected by COVID-19 related loss, and how those efforts are going to inform the department's mental health awareness and treatment programs? And is there any way that Congress might be able to be of an assistance to you in those efforts?
Excellent question. And I hope that you and some of your colleagues will follow up, because we are collecting a great amount of data, and it will be very useful, not just for our programming of resources, but for you all making policy that will take us in an even better direction. So please be in touch with my team, because that data can help drive good decisions on where we go next.
Yeah, and it certainly begins almost as empirical, right? So one of the things, obviously not related to your jurisdiction, that we're starting to see in Michigan is a major demand for guidance counselors in our schools. I've heard some reports that guidance counselors used to see in some of our schools on average 17 to 20 students, and now that's upwards of 100. And so this isn't within your jurisdiction, but just thinking about that support network that goes into our school system. And so with that, I'm going to cede back my time to the next question, Mr. Chair, partly because our secretary has just been doing such a phenomenal job. And it's obviously no question why he is in this role, and, was able to answer things that might have been better for, the Homeland Security Subcommittee. But obviously, we are going to keep pushing on what we need to do to continue to keep all Americans healthy and a strong HHS department. So with that, thank you, Mr. Chair. Thank you, Mr. Secretary. And I yield back.
Thank you. Gentlelady from Tennessee, Ms. Harshbarger.
Thank you, Chairman and Ranking Member Fox, and welcome, Secretary Becerra. We appreciate your time to discuss the 2022 budget for HHS. As a pharmacist, I look forward to opportunities to work with you and your department on areas where we should hopefully have bipartisan agreement, improving our healthcare delivery system and addressing problems. And I really thank Representative Keller for mentioning the PBM issues with the DIR fees. And because of that, and because of being a pharmacist, I've introduced legislation, and it's HR 1829, the PBM Accountability Study Act, that would address why some of the drug pricing is so exorbitant. And everybody on this committee has independent pharmacists who in their district who's struggling with this. And I'm glad the administration's budget also proposes to focus on things like substance abuse and mental health disorders. That's going to be big in my district. But I do have a couple of questions for you, sir. First one does deal with drug pricing. When the Part D program, the Medicare Part D program, was created in the Bipartisan Medicare Prescription Drug and Modernization Act of 2003, the law included an important provision known as the non-interference clause. And that inhibits the HHS secretary, number one, from interfering with in private price negotiations under the Part D program, and number two, establishing a single national formulary for the Part D program. And because of that, it's my understanding that this was put into law expressly to keep the government from interfering in the American health system in determining which medications are covered, which are not covered, as is commonly the case in many foreign countries that are single payer systems. And honestly, the evidence has been very clear that this approach, establishing a competitive market-based system in Part D, has been successful in balancing cost containment with robust beneficiary access. But nevertheless, sir, the political talk is all about the need for negotiation in Medicare Part D. And in particular, it talks about government. The talk is government negotiation. And some have proposed eliminating the non-interference provision of the law. And my question, Secretary Becerra, is, that's very confusing. And can you clarify for me whether or not there is negotiation happening today in Medicare Part D? And if so, who's doing this negotiation?
Congresswoman, thank you for the question. And I know something that we'll have an opportunity to discuss further as well. By the way, can I just say thank you to you, and if you'll convey the thank you to your colleagues in the pharmacist world for all the work that they have done to make vaccines available locally to the community, especially those independent pharmacists who really are the ones that know their community. It's been indispensable to have them step up to the plate. And can you please convey on behalf of HHS our thanks for what they've done?
Absolutely, sir. They are an integral part of the healthcare system, and we need more authority in things like that. Start with us first.
At a time when we're losing that personal contact with all those service providers, it is sure nice to have some of those pharmacists who we've known for decades, right, to be, and we trust. And so it's been great. So please convey our thanks to them.
I will do that.
On the question.
Yeah.
I'm sorry.
Ahead. No, yeah, I want you to answer the question.
Yes. We're working, and as you know, this has been an issue that not just this administration, but previous administrations have tried to tackle. And in fact, we're now in court on a number of these matters. But what I will tell you is this: President Biden has made a commitment to reduce the prices of prescription drugs. We're looking for the best way to do that. We know that there are a number of proposals that are out there, different ways that other countries have found to do it. What I could commit to you is this: we will do everything we can within our current power, but we're hoping you all, working with you, we can get more power to actually bring down the prices of prescription drugs.
Well, that's the goal, and that's where my expertise lies. I want to change topics and ask you one other thing. I understand from your previous recent hearing appearances in the House Energy and Commerce Committee and the Senate Finance Committee, you have been asked on a number of different occasions to affirm that your stated commitment to uphold all laws, including the enforcement of the Partial Birth Abortion Act. And your response to Representative Gus Bilirakis was, and I quote, "There is no law that deals specifically with the term partial birth abortion." Do you still maintain this position that there's no federal law that deals specifically with that term? And that's just a simple yes or no, sir.
Congresswoman, I wish life were just a simple yes or no. What I can say to you is, or what I try to say to the congressman and to others who've asked this question, we're going to make sure we uphold the law. We follow the law as we protect women's rights to healthcare as they see fit.
It's a simple, if you can read this, and it is, and if you can't read it, I'll read it for you. It's 18 U.S. Code 1531, partial birth abortions prohibited. And, there's a couple of things I want to enter into the record. It was a PolitiFact article, Chairman, and it's Becerra is wrong that no law addresses partial birth abortion. So if I could enter that, that would be fantastic.
The gentlelady's time has expired. You've asked unanimous consent without objection. The document will be entered.
Thank you.
Gentlelady's time has expired. The gentlelady from Minnesota, Ms. Omar.
Thank you, Chairman. I know my colleagues on the other side of the aisle have reawakened interest in deficit. I agree with them that taxpayer dollars must be well spent, but part of running a government is making sure that revenue comes in so that we can pay for all of the good work your department is doing, Mr. Secretary. The Republican Party pushed through tax cuts in 2017 that were nothing more than massive $1 trillion corporate giveaways, serving essentially only to help the rich get richer. One of the things that they promised would happen was that companies would reinvest their tax windfalls in research and development. And how did that work out? According to Campaign for Sustainable Prescription Drug Pricing between 2017 and 2018, pharmaceutical companies more than doubled shareholder dividends while investing only 6% more in research and development, which brings me to my question. President Biden supports negotiating with drug companies. Critics of policies such as HR 3 claim that this would prevent companies from innovating. Mr. Secretary, do you believe pharmaceutical industries stock buybacks and dividend constitute innovation? And will those help develop any new drugs?
Congresswoman, thank you for the question. I think the president has been very clear that we want to have a vibrant domestic source of medicines, but we also want to make sure that we're getting a fair price for those medicines for the people, whether it's under Medicare or Medicaid or any other program. And so the president has made a commitment, and I'm going to try to follow through on that to make sure that as we try to lower the prices of those drugs, we look at every type of proposal, including HR 3, to get us there.
Thank you, Mr. Secretary. I would also like to ask you about the future of our healthcare workers. Throughout the COVID-19 pandemic, contract tracing and translators with experience in hospitality, community engagement, and other fields have used their transferable skills to streamline access to COVID-19 testing, vaccinations, and treatment for communities heavily impacted by COVID-19. What plans does HHS have to ensure that contract tracers without prior public health experience can find employment and fully transition into the healthcare field?
Congressman, you're probably aware that this administration, by the way, with your help in passing the American Rescue Plan, is going to be dedicating a number of funds and resources to try to help us with the healthcare workforce. We understand, and COVID-19 taught us that we were not prepared for prime time when it came to dealing with something like this pandemic. All those gaps in coverage, all those places in America that get missed, it's a lot of it because we don't have the workforce that we need. We also have to make sure we're paying that workforce properly so that people will want to go into those fields. So we believe with some of the resources that you made available through the American Rescue Plan, that we can actually improve the condition of our public health system by improving the conditions of our workforce.
Thank you. Recently, I had the opportunity to visit an influx care facility in Texas. One thing we heard consistently from operators and the HHS staff working there was that the importance of uniting unaccompanied minors with the sponsors in the US as quickly as possible. They outlined to us what some of the barriers were in unification, including many COVID-specific issues like delayed in processing of background checks and the inability for fingerprinting to take place during the quarantine and COVID closures. Can you share with us what steps HHS is taking to unite children with their sponsors as quickly and safely as possible, and while still taking COVID precautions into consideration?
First, thank you for your visit to the site and for the oversight that you and others are performing. We're doing everything we can to try to make sure we find a responsible custodian. And I want to emphasize responsible, because we're not going to let a child go until we feel confident that that child will be cared for, because we've seen other instances where that hasn't been the case. We continue to increase the number of personnel that we have that can help us do that intake process to be able to discharge that child. But it's a difficult process. And as you've mentioned, COVID has made it more difficult. Let's put it this way. We can no longer rely on those licensed care facilities that typically would take these children and provide them the full set of services and then do the discharge the way we used to, because those facilities have had to pare down the number of kids they accept. And so these emergency intake sites that you visited are the ones that are doing some of this work. It is tough, but we're going to do it right.
Appreciate you. I yield back my time, Chairman.
Thank you. The gentlelady from Illinois, Ms. Miller.
Yes, thank you, Mr. Chairman, Ranking Member Fox, and Mr. Secretary. The Trump administration was the most pro-life administration in this nation's history, working hard to defend unborn human lives. I'm sad to say that the Biden administration is shaping up to be the most pro-abortion administration in history. It's truly sad to see our nation, which was founded on the idea of natural rights that belong to all humans, dehumanize, and attack the most vulnerable among us, the unborn. Secretary Becerra, under your leadership of the Department of Health and Human Services, the department has decided to disband the Human Fetal Tissue Research Ethics Advisory Board created by the Trump administration to evaluate grant research conducted by the FDA and the NIH and ensure that the US government was not funding or participating in unethical research. Fetal tissue may sound like an abstract term, but there's nothing abstract when researchers are ordering skulls, bones, hearts, eyes, and livers from the bodies of unborn babies who were too vulnerable to defend themselves. Human beings have an inherent dignity and should never be used as a means to an end. Using fetal tissue from babies killed in elective abortions to further research priorities is using human lives as a means rather than treating them with the dignity that all human beings deserve. So my question is, why did you decide to disband the Human Fetal Tissue Research Ethics Advisory Board? Shouldn't we do all we can to ensure that taxpayer-funded research is done in an ethical manner? And then will you commit to investing in the creation of ethical alternatives to the use of aborted fetal cells in research, drug, and vaccine development?
Congresswoman, thank you for the question, a very important question. I want to make sure that we're very clear on something. The work that we do at HHS and at NIH in the research, it is done completely according to the law. There are well-established and rigorous regulatory frameworks for the use of fetal tissue in research. Any research funded by the NIH using fetal tissue goes through all the appropriate guidelines and oversight. There is no doubt that we have had some scientific breakthroughs and life-saving treatments that have become available to Americans as a result of the work that's been done according to the law. And the legal and ethical oversight that's been in place for decades, by the way, not just recent, but for decades, and has been supported by Democratic and Republican administrations, has allowed us to move forward. Because at the end of the day, this is a president and this is an administration that is pro-care and making sure that we give our families the care that they deserve.
So do you commit to rigorously enforcing the prohibition against the sale of aborted fetal baby parts for profit?
I can absolutely commit that we will make sure that we follow the rigorous regulatory frameworks for the use of fetal tissue research.
To enforce the prohibition against the sale of aborted fetal baby parts, skulls, bones, hearts, eyes, and livers from the bodies of unborn babies?
Congresswoman, I think I'm being as clear as I can be. We're going to make sure that we not only abide by the law, but enforce the law when it comes to fetal tissue research.
It's also come to my attention that your department will be resuming intramural research using aborted fetal tissue. President Trump suspended the use of fetal tissue from elected abortions for NIH conducted research to protect the sanctity of human life. Can you justify this decision to the committee, please?
The previous administration did a lot of things that we're not going to do. What I will tell you is that what we will do is make sure that as we move forward, whether it's on research or any other items that are under the HHS agenda, we will do them according to the law and in a transparent, accountable fashion.
Thank you. We want transparency and accountability. And another question, in light of vaccine use in children, an FDA advisory panel recently met to discuss the use of COVID-19 vaccines in children as young as 6 months old. The meeting took place on the same day Moderna asked FDA to expand the emergency use of the COVID-19 vaccine to children as young as 12. Pfizer's vaccine has already been authorized for children as young as...
time is expired. If you could very quickly state your question so we can give a brief answer.
Okay, sure. Do you believe we should be treating children differently than adults when it comes to vaccinating children with a product that has not been fully approved? And do you believe that schools should require authorized COVID-19 vaccinations for their children before attending classes this fall?
Congressman, we can follow up because I know the time has expired. I'll simply say this. We
Okay.
always looked at children differently than we do adults. We let the science drive where we go, and CDC has made that, NIH and FDA have all made that very clear that before we move on vaccines, we do it with the science behind us.
The time has expired. Thank you.
Thank you. And I yield back.
Thank you. The gentlelady from New Mexico, the time, we're running short on time, but usually I'm a little more tolerant, but so I apologize. Ms. Ledger Fernandez from New Mexico.
Thank you, Chairman Scott, and thank you, Secretary Becerra. Boy, what a difference 6 months makes. Because of President Biden's leadership, Congress's passage of the American Rescue Plan, and in particular, your department's work, there's a sense of optimism. I feel it. I think everybody feels it as vaccinated people are gathering in public again. They're visiting our small businesses, and we're all looking forward to a more prosperous future. So your opening statement correctly noted that the pandemic hit the most vulnerable, the hardest. I want to focus on a few of those most vulnerable that we might not talk about enough. And as I talk about them, I'm really going to also focus on the need for facilities. So one is our woefully underfunded Indian Health Service facilities, 2, the survivors of domestic violence, and 3, those suffering from substance abuse who need inpatient treatment. So as we are opening up, we know that our domestic violence shelters are overwhelmed. They've had to turn away women and children because they don't have the rooms and beds they need given COVID's distancing requirements. I really do appreciate your answers to my friend, Representative McBath, on providing services for prevention of family violence. And as I visited the shelters in my district, they truly appreciated the American Rescue Plan's funding, but they kept going to the fact that they need help to build and keep facilities operating. They need access to affordable housing for victims as they leave shelters. So Secretary, could you briefly discuss what measures are included in the HHS budget and proposals to address the facility needs, the facility and housing needs?
Congressman, great to have you on board, and I look forward to working with you. You have big shoes to fill, but I suspect you're more than ready for it. So look forward to working with you. I will simply say this. President Biden made it very clear where his values are when it comes to Indian country. He has made an historic investment in the Indian Health Service agency that we operate here at HHS. And we're going to make sure that we are on the ground working. And I've probably met with tribes from throughout the country already, more than I think people would have expected. We know the work we have to do because for far too long, IHS was underfunded. And we're going to try to do everything we can, if you help us pass this budget, to try to really get on the ground and provide some of the infrastructure and the services that are needed back home. You also notice that this budget calls for a 2-year cycle for appropriations so that back home in Indian country, folks have a better sense of the type of funding they can expect to come out of the Congress and the federal government, because it is difficult to budget and plan your healthcare needs for your communities if you can only rely on 1 year of funding. And so we're trying to do the things that tribes throughout the country have said to us they'd like to see us do.
I truly appreciate it because, you know, it's amazing. I think the public doesn't know that we really only fund 36% of what's spent per capita nationally for healthcare, only 36% for tribal care. And I think there's a $39 billion shortfall. I think we have a little disagreement on the shortfall between what some of the advocates are looking at and what IHS is looking at. The other place where we have a really big need for beds is with regards to substance abuse. As I travel my district, you know, New Mexico has been very hard hit with substance abuse, mental health issues that lead to that. And you've talked a bit about the operational funding, but what I hear over and over again, and this is in Indian country, this is in rural New Mexico, this is in rural America, it's affecting Latinos, it's affecting Native Americans, it's affecting all Americans, is we don't have the beds that are often needed for inpatient, which means sometimes people are dying in jails because they get picked up, they're dying alone, and they need inpatient treatment oftentimes. So tell me what IHS's proposal are regarding that aspect.
As you know, the more than $2 billion that the president calls for in his budget will try to address a number of those concerns, but it's going to be difficult to make up for years of underfunding in one budget. And I would look forward to working with you. And this is what I've said to tribes as I visited in these last several months that I've been secretary. We look forward to working with folks on the best ideas and how we move forward, both in terms of facilities and in services, because we know in both cases, there is a dire need to be ready and go in making it better.
Well, thank you so much, Secretary Becerra, and we'll follow up with you also with regarding the issues around the beds that are needed in domestic violence shelters as well. And my time is up and I yield back. Thank you, Chairman Scott.
Thank you. The gentlelady from Indiana, Ms. Sparks.
Thank you, Mr. Chairman. Thank you, Secretary, for testifying in front of us. As a member of the Judiciary Committee, I visited the border several times, and I was surprised to learn of the change of the policies that your agency did from the Trump policy related to them unaccompanied minors. So to release to unaccompanied minors to potential sponsors, Trump administration required all sponsors and adult household members to undergo background checks. I was told that you changed your policy, which I look at the press release from your agency on May 5th, and you confirmed that you did change your policy. So my question for you, by cutting corners and eliminating this proper background check, why would you change this policy? And don't you put the life of these kids at risk?
Congresswoman, thank you for the question, and critical question, because we want to make sure kids are safe. What we did was we took into account where there was a parent, not just an adult, but the actual parent of the child, that while we did do a check and we do thorough analysis to make sure that this is the parent of the child, we feel far more confident if this is the actual parent of the child, that we can try to make sure that the discharge occurs as quickly as possible.
Well, I get it, but your policy doesn't say that you don't do it just for parents. It just say for any sponsor, it may be not a parent, you don't have to check household members, regardless who they are. Isn't it by creating this policy, you potentially don't know where the kids go? How you even track the child welfare? Are you created now a situation where this life can be at risk? Regardless, and then you don't even know where the parents, what kind of household they live. So you're now not checking anyone in that household. Is it potentially cutting corners and putting their life in danger? Or you believe that is not?
Congresswoman, I urge you to reread the guidance that we put out and the instructions, because I think you have misread it, but I'm more than willing to sit down with you to go through and explain it later on with my team. We do not put any child in danger. We make sure that we place them in the hands of.
But is it correct that you're not requiring to do the adult household members of sponsor background check, unless there is a reason to believe? But as a policy, it was a change of policy. Do you agree with that? Because that's what it says in your press release.
Congressman, we don't release any child into the hands of any person, including a parent, until we can confirm that they are not only the parent or a responsible adult, but that we can have the confidence that those children will be safely cared for. So no child, regardless of who the custodian might be, parent, adult, family member, or not.
But you don't check background checks. You don't do background check. You don't require.
We absolutely do background checks.
So your actual employee required to do background checks all household members of that sponsor.
Congresswoman, as I said, I urge you to read our policies.
So I just read it, so maybe you communicated, because that's what I was told by people on the ground in the shelters. That's what your press release says. So maybe you need to communicate that policy better, but we'll try to clarify then and follow up with you. And I yield balance on my time to Congresswoman Fox.
I thank the gentlewoman for yielding. Secretary Becerra, you recently testified before the Senate Finance Committee that you'd be open to revisiting the ACA definition of affordability for employer-sponsored coverage. Currently, employers must offer plans that cost 9.83% or less of the employee's household income. When you talk about revisiting this definition, do you mean lowering the affordability threshold, which will either move more employees onto the ACA exchange or increase costs for employers? According to 2020 coverage data from the Treasury Department, the cost per family to taxpayers on the ACA marketplace is $5,722, while the cost per family for employer-sponsored insurance is $3,974. How would this proposed change to the definition of affordability be affordable to taxpayers?
Congresswoman, I'm more than willing to follow up with you and your team if you'd like to explore this, but what we're going to do is, if we're going to make any changes, it's to make sure that the healthcare coverage is more affordable. We're not about to make any changes that would cost an American more money to access the quality of healthcare that would be available through the ACA.
Well, when taxpayers subsidize healthcare for those who are on the ACA, that is costing taxpayers money. And by the way, in your recent testimonies, every time before a committee, you've been in person. With that, Mr. Chairman, I yield back.
Thank you. The gentleman from New York, Mr. Jones.
Thank you, Mr. Chairman. A few minutes ago, the Secretary was lectured on the importance and the sanctity of human life by a member who just yesterday voted against awarding the Congressional Gold Medal to our brave police officers who risked their lives and in some instances even died to save us in that violent insurrection on January 6th. And I think it's important to call out the hypocrisy of that. Secretary Becerra, today I would like to ask you a few questions regarding Head Start. As you know, Head Start programs across the country provide vital early education to children from low-income households, ensuring that they are well prepared to enter primary school. These facilities work to develop social skills and emotional well-being in young children, as well as offer them nutritious meals, health screenings, and mental health supports. As we build back better from the COVID-19 pandemic, we must recognize that the public health crisis has presented unique challenges for low-income communities, the same communities served by Head Start programs. Many families lost sources of income and daily childcare services. Despite most Head Start facilities closing their doors in order to protect public health, many still worked tirelessly to provide resources and support to children and families facing new challenges as a result of the pandemic. So, Mr. Secretary, we know that the Head Start Act has not been reauthorized since 2007. And in that time, Head Start programs in many parts of the country have found the disconnect between the income eligibility thresholds of 100% and even 130% of the federal poverty line to be inconsistent with how expensive it actually is to live in this country and what it actually means to be in poverty. This is especially true in high-cost areas like the one I represent in New York, and of course, the one that you represented when you were a member of Congress. What actions will you take to ensure that Head Start is available for young children in need, but who currently might not be eligible due to outdated eligibility requirements?
Congressman, I could not agree with you more in the way you've articulated this. We have too many families who are modest income, working really hard, but are losing their opportunity to qualify for Head Start. And even for families who do qualify, we just don't have the resources to help the way we should. And so the investment that this administration has made of over $1 billion in Head Start will take us a little farther in making sure families have that opportunity. You and I would probably agree how tremendously important it is to give that child a chance to start on the right track as they get ready for kindergarten. And Head Start is crucial. But what we can't do is let hardworking, low-income families miss out simply because the rates have, become unbalanced so that they don't qualify, even though they really don't have the resources to pay for something like that on their own.
Thank you. I want to keep our focus on Head Start. You know that in fiscal year 2020, Congress deliberately allocated resources for Head Start programs to address the concerning rise of childhood trauma throughout our nation. Gun and domestic violence, prescription drug abuse, disaster-related displacement, loss of a parent and other traumatic events can leave a child further behind emotionally, physically, and educationally. With those critical funds, Head Start programs pursued trauma-informed care training and increased access to mental health counselors. They'd also developed unique strategies to support Head Start families. But nevertheless, these Head Start programs are already reporting a significant uptick in pandemic-related trauma for children and families. And while there is a desire for the administration to expand Head Start and move forward, many programs are still grappling with COVID-19. Would you support increased and specified funding in fiscal year 2022 to help Head Start programs in addressing the mental health and childhood trauma issues for existing families?
Congressman, I would love to be able to say that that's what we will do. I will work with you to make sure we have the funding for that. The only hesitation I have is that I don't want to lock out sources of funding for other valuable, vital services within Head Start. But you are absolutely right. If we don't tackle this, we're letting the child become a ticking time bomb as they grow older. So we absolutely have to do something to provide that mental health service.
Thank you. And finally, can you speak to the role that Head Start will play moving forward as you seek to expand early learning opportunities through your proposals?
If I had my way, Congressman, we would make sure every child, your child, my child, who cares whose child it is, have a chance to have that start. And we want them to be ready to learn. And you got to give them that chance at a Head Start.
Thank you, Mr. Secretary. I yield back, Mr. Chairman.
Thank you. The gentleman from Wisconsin, Mr. Fitzgerald.
Thank you, Mr. Chair, and thank you, Mr. Secretary, for being here. I probably have a unique perspective as one of the members of the committee today, having worked in Wisconsin legislature during the pandemic. And as you probably are aware, Deputy Secretary Andrea Palm was part of the Evers administration. There's a patchwork of local ordinances, both at the municipal level and at the county level. Many of them are antiquated, as well as state statute. And when the pandemic hit, I quickly identified, I think many of my colleagues identified, that there were significant issues that hadn't been addressed. And it became kind of a push and pull oftentimes amongst the different levels of government as to what was an adequate response or a response that would make sense. And I disagreed with Governor Evers in Wisconsin as the Senate Majority Leader. And I also disagreed with Secretary Palm on their approach and then how long they held kind of played things close to the vest on what their approach would be. Let me ask you a couple questions. If there's a resurgence in COVID or a variant, what's the administration's position on lockdowns and mask mandates? I know that candidate Biden, President Biden now, had absolutely said that he would support some type of national mandates on those fronts. Where are you guys at on that right now?
Congressman, thanks first for the question. And your question, while maybe hypothetical, could ultimately happen. And so what I would say to you is that what the president has always said is that we're going to have science guide our best practices. And we're going to try to make sure that we are right there with our state and local partners and never abandoning those partners. And what we're going to do is work with them, because the ultimate decision is up to the states and local government leaders on how to proceed. The federal government does not mandate to a state or to local community how to do things, but we do have jurisdiction. The president has been very clear on asking if it involves transportation that goes beyond states and those kinds of things where he does have authority. We're going to do everything we can to protect Americans. We're going to do everything we can to beat back COVID. We're going to do everything we can to get people vaccinated as quickly and as thoroughly as possible.
Would you go as far as to say that you would call for a mandate on that?
Well, as you've heard the president say before, those decisions are really state decisions, not for the federal government. And so right now we've been working closely with the governors and our state partners to make sure that we provide them with every type of support that we can. So as they move forward for their states, do this in as safe a manner as possible to promote their health and the return to normality for all these people.
Let me ask you a further question on vaccinations then. It seems that with certain segments, age groups, we've kind of hit the wall on vaccinations. There's just a number of people that are saying, I am not going to take the vaccination. I'm not going to force any of my children to take the shot. What is your approach on that? And what are you going to do about that?
Well, we continue to reach out. We think that there are still millions of Americans who want to have a vaccination, who are willing to come forward. We want to find them. We're going to go to them. We're not going to wait for them to come to us. We want to make it available. You no longer have to wait in line. You don't have to worry about your age as long as you're 12 and over. And we're going to do everything we can to work with trusted partners in the community to reach those folks. We are continuing our efforts. We just established, for example, a youth corps to help us reach out to young Americans who haven't yet been vaccinated. And so we're going to continue to do all the work, whether it's establishing a toll-free number, a website, a way to get the information on where the closest vaccination site is to you, and of course, mobile clinics, all the rest. The wrestling coach or the—
No mandates though? No mandates on vaccination?
As I said before, we leave that to the states to decide how they go about doing that. We're going to be their good partner and not abandon it.
Let me just one more question on the COVID topic. So have you done any work on the front of helping?
The gentleman's time is about to expire.
Helping
That's a quick question and a quick answer.
Yeah. Well, hospitals and healthcare workers. I mean, huge issue still exists. And I'm wondering what the administration is doing to shore up hospitals and the shortage of healthcare workers.
We're going to do everything, Congress, we can to make sure that we have the PPE and all the supplies that we need. Healthcare workers should be the last people who should run out of those kinds of supplies. We're working with hospitals. We've got the Provider Relief Fund. Congress, we can give you a more detailed response, but we're going to be there every way we can.
Yeah, yield back. Thank you.
Thank you,
Mr. Chairman, there's interference when the secretary is speaking.
I think that was on Mr. Fitzgerald's part.
No.
I think. Well, let's see how it goes with the young lady from North Carolina, Ms. Manning.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being with us today. I want to talk about a kind of health insurance plans that the Trump administration took steps to increase. They increased enrollment in junk health plans that evade consumer protections under the Affordable Care Act. And these included products like short-term limited duration insurance policies, which do not cover essential health benefits. They charge higher premiums for people based on illness, and they discriminate against people with pre-existing conditions. Can you talk to me about what steps the Biden administration plans to take to reduce the harmful impact of these kinds of plans on consumers?
Congresswoman, thank you for the question. And we intend to enforce the Affordable Care Act. The Affordable Care Act was all about providing consumers with real coverage at an affordable price, not duping people into thinking they've got health insurance and the day they use it, find they've got this massive bill they can't afford. We're interested in making sure that if an insurer wants to peddle a plan out there, that it is not junk. And so we're going to work really hard with the powers that we have and any you decide to give us to make sure that no insurer goes out there and sells a faulty product that's nothing but junk to the American people when it comes to healthcare.
Thank you, Mr. Secretary. And like many Americans, I am deeply concerned about rising prescription drug costs. This became an issue with my family. I have personal experience with a daughter who was diagnosed with a chronic illness, and I was stunned by the cost of the medications that she needed to live a normal life. So what is the Biden administration going to do to help us bring down the cost, the really outrageous cost of so many different kinds of prescription drugs?
And Congresswoman, here's where I hope you all will decide to help us with some changes in statutory law. And that is, the president said, you let me negotiate drug prices, I will do it. To the degree that we have the power to do that, we'll try to do it. As you know, some of those issues are tied up in court. He has said we're going to look at every way that has been devised, including in other countries, to figure out how we can lower the cost of prices of drugs. The president is very focused on this. Prescription drug prices are just too high, and there's no reason for it. And we're going to do everything we can. We hope we can work with you so that we'll have even more authority to bring down the cost of those drugs.
Thank you, Mr. Secretary. The people in my district need the relief, and the people all over the country need the relief. So we look forward to working with you on this issue. I'd like to turn to a different issue, and that's the impact that COVID has had on women with postpartum depression and other mental health issues. Certainly, the isolation forced on people by the pandemic has exacerbated these kinds of issues. Can you talk to us a little bit about the funding in the budget to address maternal mental health issues?
Congresswoman, thank you. This one's really important because in a country as sophisticated and as talented and as wealthy as America, we should not have women who are actually dying postpartum. And so one of the things that we have done is not only invested some additional funds in providing maternal health services to women, but we've now put out a program that so far a couple of states are looking at. I think we have, Michigan has signed on to a program that actually provides a woman with postpartum care beyond 60 days, which is what currently is provided under Medicaid. We're willing to help that state extend postpartum care for that woman for up to a full year. And we will be great partners in helping finance that. And we hope that there will be states who take that up.
Thank you so much. This is a huge issue. There are many of us here who look forward to working with you on addressing maternal health issues. So thank you for that, for all your dedication. Mr. Chairman, I yield back.
Good. Thank you. Thank you. Your colleague from North Carolina, Mr. Cawthorn.
Excellent, Mr. Chairman. Thank you very much, Dr. Fox. Thank you for your leadership. Secretary Becerra, congratulations on being appointed as Secretary. What we have seen out of the Department of Health and Human Services, I believe, is nothing short of rank hypocrisy. I'm confused when the health of the American people and their best interests has become a political tool. Quite frankly, I find it disgusting. Now, sir, as head of the Health and Human Services, I assume you're aware of the CDC policy that states children 2 and over must wear a mask in public, correct?
Congressman, the guidance we provide is based on science and it's guidance to the states, and they can decide how to implement.
Correct, but your guidance is that children 2 and older must wear a mask.
We want everyone to be safe, Congressman.
Affirmative. Children 2 and older must wear a mask. Now, I also know that science has indicated that young people, especially our young children, are less likely to have serious symptoms from COVID-19. Is that what your findings have told you?
Less serious doesn't mean they don't become serious. We want to make sure every American is protected as best possible, and we leave that to the states to decide exactly how.
Of course, but according to the science that's been released by the CDC, children that are very young are less likely to have serious symptoms, much less likely than older people or people with diabetes. Now, Secretary Becerra, you are aware that the youngest age recommended for a vaccine currently is 12 years old. Is that also correct?
Right now, the CDC guidance says 12 years and old.
Understood. So now let me get this straight, and please forgive me if I'm reiterating some things, but the CDC recommends that a child 2 or older has to wear a mask in public. Yet they also advocate for children not to get a vaccine until 12 years old. Is that what you understand?
CDC is trying to make sure we protect all of our loved ones, including our children.
I understand that we're trying to protect everyone, sir, but you understand that you have to wear a mask at 2 years old until you're fully vaccinated, but you can't get vaccinated until you're 12 years old, correct?
You understand the science behind saying a mask helps protect a child and the science behind saying when a child can get vaccinated. You're mixing apples and oranges, I think.
Well, I disagree with you there, Secretary. But so putting this all together, essentially, a 2-year-old is not recommended for the vaccine. But the only way that you can take a mask off in public is to be vaccinated. So essentially, CDC's policy is to keep masks on our children for up to 10 years. I mean, what is your defense for that?
First, I think you have described it improperly. But what I will again repeat is that we are trying to make sure that no one, including a child, contracts COVID, because it can be dangerous for everyone, including a child. The safer we all are means the sooner we can return back to normal.
I understand, sir, but the current CDC guidelines, which have no sunsetting period, are saying that they have to have a mask on after 2 years old. They can't get a vaccine till they're 12. And now I don't expect you to get into the weeds regarding psychology, although you are the Secretary of Health and Human Services. But are you aware of the studies that have shown that masks on children impacts social integration? It disadvantages our younger children from developing the necessary skills to discern emotions. It creates a depression and even delayed speech. Now, I assume you're aware of these studies.
Congressman, again, I hope you'll recognize, as you said, CDC is offering guidance. It is not mandating. It is offering guidance based on the science.
I never said you're mandating, but you're offering guidance, which is a significant amount of blue states.
But you did say that kids have to wear, and what we do is provide guidance. If a child is wearing a mask, it's probably because the parents have made the decision to have that child wear a mask.
And I believe it has been well founded that almost every single blue state in this country follows the guidance that the CDC is putting out. I mean,
I would hope every state would follow the guidance.
Excuse me, Mr. Secretary, I have limited time. What kind of emotional damage do you think keeping these children masked will do to our next generation?
We're going to try to make sure that no child goes through any emotional trauma. Losing your parent could be as traumatic as anything I can think of. And if you're not safe from COVID, there's a good chance that you might lose a loved one. So we want to make sure everyone is as safe as possible.
Well, Mr. Secretary, I too want everyone to be protected. But Mr. Secretary, I've got to say, sir, I'm disgusted. Studies clearly indicate that the primary time for social and emotional development among our children begins and ends precisely in the same time frame you would muzzle America's youth. Now, I know you say it's just a recommendation, but many, many, many people are following it. You know that young children are unlikely to be severely impacted by COVID, but you don't care. You know that COVID is statistically a medical afterthought for children ages 2 to 12, but you don't care. You know that CDC's own guidelines, and I know it's not a mandate, but their guidelines restrict access to vaccinations for individuals under 12 currently, but you just don't care. You know that the study after study has shown that mask wearing at a young age can impact social, emotional, and relational capabilities. But sir, you simply don't care. And if you want me to send you those studies, I'm more than happy to have my staff have those sent to you. Now, Secretary Becerra, let me tell you what you do care about, sir. Because from my evaluation, you care about power. You care about muzzling America's future, our children, and forcing them to wear a mask from ages 2 and 10. 10 years before they can breathe the air of freedom in this nation. Sir, I will remind you that we are not descended from fearful men. I believe we can beat this virus. I believe that our young children are absolutely very close to being immune. And sir, with that, I yield back.
Thank you. The gentleman from Indiana, Mr. Mervin.
Thank you, Mr. Chairman. Secretary Becerra, the Child Abuse Prevention and Treatment Act supports the community-based services for primary federal program to provide funding for child abuse and neglect. It also requires that every state has a system in place to identify and provide an initial response to child abuse and neglect. Earlier this year, my colleagues and I, including Ms. Stevens and Ms. Stefanik of this committee, led a bipartisan letter to the Appropriations Committee that requested a meaningful funding increase for CAPTA. I'm glad that the president's budget called for $235 million for CAPTA programs, an increase of $49 million above last year's enacted level. We know that CAPTA has been underfunded for many years and not enough families have access to prevention services. Why do you think, and why is it important now is the time for greater investment in CAPTA?
Congressman, thank you for the question. I think you'll agree that for far too long, we have underfunded these services. And I think we're interested in trying to move forward as quickly as we can, do a better job. I hope that you all and many of your colleagues are interested in helping us move forward because, I mean, the consequences of not acting are severe. And so I thank you for the work that you're doing on this. And I hope that you'll find that my team is ready to work with you to not only increase the funding, but really implement in a way that works for each local community, wherever they may be.
Thank you, Mr. Secretary. In my district, I attended an open house for Ashley's House, a transitional residency offering wraparound services for survivors of human trafficking. It is operated by Dr. Kalyani Gopal, a psychiatrist specializing in sexual trauma and victims of human trafficking, who shared with me the challenges and grant opportunities for residency services. My question is, will you consider opportunities for resident services providers for survivors of human trafficking? And can you share HHS's approach towards human trafficking?
Thank you, Congressman. I would look forward to working with you on that because we know that human trafficking occurs here in the United States more often than people want to believe. And having the responsibility to care for these unaccompanied migrant children who are coming across the border, who oftentimes we've seen in the past were at least reported to be used for trafficking purposes, whether labor or sex. That's a very important issue. So definitely would look forward to working with anyone, you or others, who are interested in trying to deal with this issue and making sure that we're extending more services to those who might be trafficked.
Thank you, Mr. Secretary. With that, Mr. Chairman, I yield back my time.
Thank you. Is the gentlelady from California, I understand the gentlelady from California, Ms. Steele?
Thank you very much.
Recognized for 5 minutes. Thank you.
Thank you. Thank you, Chairman Scott and Ranking Member Dr. Fox. And thank you for joining us today, Secretary Becerra. I have heard directly from many families in Southern California that are frustrated by state officials who advocated to keep our schools shut down. These actions put students' futures and in many instances, their lives in danger. Many families feel officials fail to provide federally mandated accommodations. The director of school mental health for Los Angeles Unified District recently stated he was worried about those fell through the cracks due to students being kept from school. As of March 2021, 80% of students in Florida were attending schools in person, full or part-time, without turning schools into super spreaders. At the same time, almost 6 million California children were unable to attend the classes because nearly all California public schools remained closed. According to Gallup, nearly 3 in 10 parents say their child is experiencing harm to their emotional or mental health because of social distancing and closures. So my question is, you mentioned during your confirmation hearing, the ultimate decision on school reopening is a local one, yet state officials force schools to stay closed longer. I have heard from parents and have seen many heartbreaking stories about children who suffered mental health damage because they were not allowed back in the classroom. Do you agree that the dangers of keeping at-risk children out of the classroom this year far outweighed the risk of bringing them back?
Congresswoman, thank you for the question. Well, first I should mention how President Biden has made it very clear he'd like to see children back in school. I think we all would like to see them back in school. And we want to make sure that we're doing the reopening of our country as safely as possible. We saw, we don't have to go back just a few months to see how bad things can be and how many Americans, more than 600,000 American lives we've lost. And so when it comes to the reopening of schools, we have offered guidance to our local school district partners so they can make the best decisions possible as safely as possible. But there's no doubt that we're hoping, and the president made it very clear, we'd like to see kids back in school and do so safely. And when it comes to opening every part of our country, not just our schools, we're working with our state and local partners to make sure it's done with the science driving our decisions.
Thank you very much. I yield back.
Thank you. The gentleman from New York, Mr. Bowman.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here today. And thank you for your lifetime of care and service to our country. I have great respect for all that you've done and all you're going to do. Prior to coming to Congress, I worked in public education. I worked as a teacher, a school counselor, and a middle school principal for 10 years. I actually had the privilege of opening up my own public middle school, community public middle school in the Northeast Bronx. And, as I spent a career serving my students, I learned throughout that time that, it's really important for social services and healthcare to be connected to the work that we try to do in schools, both for children and families. They're not just spaces for academic support. Obviously they are, but children come with so many social and emotional needs that the collaboration, interagency collaboration between schools and social services needs to be sort of centered as we go forward. Can you just comment on that and also speak about what collaboration looks like at a federal level between HHS and the Department of Education?
Absolutely, Congressman. And can I just say thank you for your service? I know that some of those years were probably very tough, but at the end of the day, you can't be more enriched than watching children become leaders of this country for tomorrow. So thank you for what you've done, your service here today, but perhaps even more so your service educating America. And you're absolutely right. Schools are more than just educational institutions. They are hubs of a community, and we should make use of them. I mean, in some communities, especially in inner city communities, sometimes it's the only green space that people have. And so we should know that we should be using that school as an asset, not just to teach our kids, but to bring a community together, to have gatherings of neighbors, to provide health resources to children and families. Our schools are precious, and you know this because you were there for so many years, and we should make true investments in our schools, not just in providing instruction to our children.
Mm-hmm. Are you familiar with the community school model? The model where, you know, there are several different models. One is the full service community school where, you know, a family can come, a parent can come, drop their child off at school, and then go to the nurse, go to the doctor themselves within that school facility, even receive dental supports in some cases, and also additional mental health supports for parent and child. Are you familiar with it? Have you seen it work? And how can we do more of that and provide a pathway at a federal level to make sure that happens?
Yeah, having served 24 years in Congress and represented a modest income district with a lot of working families who have to, in some cases, have two jobs and therefore need support for their kids. I myself grew up as a latchkey child. We understand what it takes. And this concept is not new. It's just having the resources. You can't put it all in the school district, and it's great in some places, the cities are actually working with the school districts. So they're combining city resources for recreational services and so forth with the district. And in many cases, you've got nonprofits who are coming in, but quite honestly, it's the parents, it's the community that step forward to make that possible. And those, I mean, why would you not want to have a one-stop shop at a school where you can provide all these services, principally to families who really don't have that much?
Mm-hmm. Another thing I wanted to ask about is the early childhood stage of a child's life, which is so important, all right? When we think about the first 1,000 days of a child's life, and I know we talked a little bit today about Head Start and pre-Head Start programs, but I wanted to highlight, I don't know if you're familiar with the term ACEs, Adverse Childhood Experiences. I'm sure you probably are. And ACEs, when they become compounded, lead to toxic stress, chronic trauma, and long-term negative health and education outcomes. What's your vision for, you know, doing more in the early childhood space to ensure we combat ACEs so that children are ready to enter kindergarten, you know, hitting the ground running because they grew up in a more nurturing space during the first 1,000 days of life?
Congressman Frederick Douglass once said, "It is easier to build a strong child than to repair a broken man." And ACEs, and what we learn from that is that if you reach a child, even though they suffered through a trauma, you can actually repair that child and let them grow up and be healthy. But if you wait too long, you're going to have a broken man or woman to deal with, and it is far more expensive. And so better to invest early in a child than to wait to try to repair them when they're men and women.
Thank you so much. I yield back. I look forward to working with you. You're such a breath of fresh air. Thank you so much.
Thank
you. The gentlelady from Louisiana, Ms. Ledlow.
Secretary Becerra, I appreciate you coming to our committee today to discuss the administration's Department of Health and Human Services policies and priorities. I was encouraged to hear during your testimony that the department will look to continue focusing on rural communities. Much of the 5th District of Louisiana is rural. My constituents and I see daily the unique challenges that rural America faces in healthcare, many of which have been exacerbated by the COVID-19 pandemic. Our rural hospitals and providers in the 5th District are an extremely important lifeline that provide care and services of critical importance to our rural communities. During the COVID-19 pandemic, many were in danger of fiscal disaster, but thanks to the Provider Relief Fund, most were able to survive the pandemic and have been able to continue providing essential care to their communities today. I hope that this department will do everything in its power to ensure our rural hospitals and providers have the necessary tools and resources to continue serving their communities. I was also pleased that you mentioned the importance of training for health professionals. There is a considerable shortage of health professionals in the workforce today. And as we look towards the future, specifically, I would like to bring up our nurses. During the pandemic, the demand for nurses has skyrocketed. And in Louisiana, we have seen this demand create staffing shortages. The Louisiana State Board of Nursing estimated that the nursing shortage in our state would nearly quadruple from 2019 to 2025. Nurses are an integral part of our healthcare system, and we need to ensure that we have a healthy and vibrant nursing workforce. The care and comfort nurses provide to patients and their families is reassuring and helps many individuals get through some of their most difficult times. I hope that we can work to address the nursing shortage that is increasing not only in my state of Louisiana, but across the nation. We are headed towards a true crisis if we cannot address the shortage of staffing for health professionals. According to the American Association of College of Nursing, U.S. nursing schools turned away over 80,000 qualified applicants in 2019. This includes around 1,400 just in my state of Louisiana. Secretary Becerra, what do you believe needs to be done to address the critical issues of nursing education and curbing staff shortages now and into the future?
Congresswoman, wow, great questions, because you're thinking ahead, and especially for nurses. We all talk about doctors, and my wife's a doctor, but she talks about nurses more than she talks about doctors, because she understands that there's nothing a doctor can do very well without the nurse. That's right. I hope that you work really hard on this, and you'll have a partner here, because we need to increase the attraction to nursing by our young people who are talented and want to serve. And I hope that what we can do is make sure that these young people are willing to go anywhere, including rural America, because that's where it's toughest to recruit some of these folks. And so we can come up with programs that'll give that incentive to that young person to go into nursing program. And we can provide a program to give incentive to providers to have a better policy when it comes to how they recruit those nurses, future nurses of America. We're making an investment in rural America, close to $500 million, to try to reach out to those healthcare providers in rural America. We have a fund of close to $8 or $10 billion to try to help rural America go through this pandemic with the Provider Relief Fund. And so we look forward to working with you. Hopefully you'll agree that we do this transparently to get monies out to every community, but including our rural communities.
Thank you, Secretary. I have one follow-up question. As a mother of two beautiful children, I believe in the sanctity of life. I'm deeply concerned the department's budget did not include the Hyde Amendment. This long-standing policy to prevent taxpayer dollars from funding abortions must be retained. I am further concerned about the department's decision to rescind the previous administration's Protect Life rule and now allow abortion providers to receive Title X funding. The majority of Americans do not want their tax dollars funding abortion procedures. Secretary Becerra, as a former member of Congress who has voted on bills that included the Hyde Amendment, can you explain to the committee why the administration has decided to abandon this 40-year-old precedent?
Congresswoman, thank you for the question. And I do very much look forward to working with you, even on these tougher issues. I respect that sometimes we have very deep-seated beliefs and values in the way we look at some of these issues, even though we may look at them differently. What I can tell you is that we're going to make sure that we provide access to good health care to all people. We're going to respect the law. And ultimately, it's Congress's decision what will be included when it comes to the issues of the Hyde Amendment.
Thank you, Mr. Secretary. I yield back my remaining time.
Good. Thank you. The gentleman from Wisconsin, Mr. Buchan.
Thank you very much, Mr. Chairman and Mr. Secretary. It's great to see you again, as always. You recently added to your staff someone from my staff, and she had been there all 8.5 years plus earlier. She's amazing, so take care of her, all right? She's very, very talented, and
He's listening to you, Congressman, so be careful. Okay, well,
just want to let you know, we miss her, but you got a great add to your office. Let me ask you a question about ACA, insured denial of claims. There was a report recently from Kaiser Family Foundation that said 1 out of every 6 in-network claims in 2019 was denied. under the ACA, and there's a 17% denial rate, or that rate is higher than the 14% rate in 2018, double the 8% denial of claims experienced by Medicare Advantage plans. You know, obviously, beside the concern of those high rates, those plans have ranged from 1% to over 50%, depending on the insurer. I'm just wondering a little bit about that, because I know that, you know, CMS does not currently require healthcare.gov insurers to report all the transparency data required by the Affordable Care Act. Additionally, data reported by issuers are not audited by CMS, and the federal government has not made the data publicly available in a format that's easily usable. Should I be concerned? What are we doing around this? I just want to make sure that, you know, again, we've got healthcare coverage as extensive as possible for everyone.
Congressman, first, great to see you, and thank you for letting us steal some of your talent. I will say this, I want you to stay on top of these things. I want you to be a bulldog on this stuff, and I want you to keep us accountable as well, because I intend to do that also. We're going to do the auditing, we're going to do the accountability to make sure that if you're going to get money from the federal government to administer a plan, that you're doing it right and you're not shortchanging Americans who deserve to have a policy covered.
Great, and I appreciate hearing that. And I assumed nothing less, to be perfectly honest, but I did want to raise the issue because, you know, I think as much as I so strongly support the ACA, we want to make it really live up to its promise that when you all created it before I got to Congress. An issue I mentioned one other time briefly to you about Kratom is something that I know we haven't put a new head of the FDA in yet, but you know, we've had some issues. This is a drug a natural substance, I should say, not a drug, that has helped many people get off of addictions like heroin. And it's been something where the FDA has previously had a pretty Neanderthalic response to, and we in recent budgets put some money for research, and it's showing to be very promising for just that, helping people get off of things like heroin or people with chronic pain conditions and not have addiction properties. We found out recently there was a 2018 HHS letter that rescinded a recommendation to the DEA to the FDA by the U.S. Drug Enforcement Agency to classify some of the kratom alkaloids as Schedule I substances, which would have made it even harder for people to get help or us to do the research we want to. This letter was kind of kept from the public view for a couple of years, and only through a request we found it. I guess my question is, given some of the past mishandling we've had and the lack of transparency, it would be great if you could work with the FDA to issue a comprehensive public report about it, and you know, especially without an FDA head yet. They recently took an action on a company seizing their product. Again, this is a legal product that's helping a lot of people. I'd like to try to make sure of that, and any efforts you could do to help us would be much appreciated.
Congressman, first, what I can tell you is that acting Commissioner Woodcock is working hard on all of these subjects. I know that we are looking at the subject that you mentioned with regard to kratom, and we can try to keep you abreast as best possible. But what I can tell you is what I think Dr. Woodcock would tell you is FDA operates based on the science, and the scientific independence that FDA has enjoyed for a long time is something we're going to respect. We will work with Dr. Woodcock and the FDA here at HHS, since they're part of HHS, but we respect the fact that the FDA has had this independence to make scientific decisions, so that way folks don't have to fear that politics entered into those final decisions that they're making. But something you've mentioned on kratom, look, we're going to probably have about 90,000 people who die in the next 12 over the past 12 months from opioids, and so we absolutely have to do something. Look forward to working with you on that.
Yeah, and NIDA, when they were up for a hearing recently, they also said the research is very promising. So I just want to make sure that we don't have the wrong actions happening at a time that we're really getting some good research right now to help us. Thank you very much. It was great to see you again, Mr. Secretary. Thank you, Mr. Chairman. I yield back.
Thank you. I don't see any other Republicans. Dr. Fox, you want to be recognized now?
Yes, sir.
Okay, we have a couple of other Democrats that will be seeking recognition. The ranking member is recognized for questions for 5 minutes.
Thank you, Mr. Chairman. And I think my question comes very, very timely after what the Secretary just said. And thank you, Mr. Secretary, for being here. Your emphasis on scientific decisions. When President Trump was, when President Biden was elected, he pledged to, quote, follow the science. And you have done that many times today and said you're going to enforce the law. I'm very concerned, though, by the abrupt departures from the CDC shortly after President Biden's inauguration of Drs. Nancy Messier and Ann Schuchat, two knowledgeable, well-respected, and experienced professionals. News reports say they were pressured for their positions, which disagreed with your administration. So please tell me why these two scientific, well-known, experienced professionals left the Biden administration. Were their departures related to policy and scientific disagreements with incoming Biden political appointees?
Congresswoman, you've asked something really important because I'm not aware of those reports, and I know the two individuals, both of them immensely talented, dedicated career employees who've done tremendous things. And I have nothing but great things to say about their service to our government and to the public. What they've done to help us through COVID and all the rest is just astounding. But I know of nothing of the sort in terms of their decisions being based on what you've described. But I can guarantee you that I believe in the independence of the FDA to make decisions based on science. I visited FDA and in front of the entire team, I mentioned that to them.
Yeah, okay. Yeah, this is with the CDC. So you might want to talk to your CDC director about that.
I'm sorry, I apologize. I meant FDA, I meant CDC.
Yeah.
Same thing applies, I apologize,
right.
Forgive me.
Okay. Well, Mr. Secretary, the Biden administration did not start from scratch with COVID-19 vaccine development, procurement, and distribution efforts. Operation Warp Speed is one of the greatest technical and logistical accomplishments in U.S. history. As a result of President Trump's leadership and unwavering support for OWS, incredible American scientists and private sector innovators partnering with the federal government produced and delivered hundreds of millions of effective and safe vaccines. The Biden administration inherited a well-oiled machine. In fact, by January 2021, OWS had already purchased 400 million doses of vaccine and delivery around the country was underway. What are you doing to ensure that the tools and the structure created by Operation Warp Speed are not lost and the lessons learned from this historic endeavor are applied to programs managed by your department in the future?
Congresswoman, I think what we've seen accomplished under the leadership of Mr. Perna has been tremendously important. And I hope that what we continue to see is the building from all those lessons that we've learned moving forward, because what we can't do is face a situation where we lose 600,000 lives in this country again. And I think that everyone working together makes no difference what your political background is, your partisan affiliation. If you want to do good work, we want you to serve, and we're looking forward to having people continue to work on behalf of the American people. And my apologies again for having slipped up on CDC, FDA. We just finished talking about FDA. I meant CDC throughout that. Although, again, both agencies, I think we recognize, base their actions on science. So my apologies for
we keep hoping, we keep hearing that said over and over again, but what we see happening is not necessarily consistent with what you say. I'd also like to point out that in recent comments that have been made where you've talked about women with postpartum depression, women dying postpartum, woman with postpartum care. You know, I'm glad you dropped the silly use of the word people from that. You know, when we see the first man have a baby, we'll know we've had a scientific breakthrough, or maybe the Lord at work changing his grand scheme for the way we should be operating. With that, Mr. Chairman, I yield back.
Thank you. Our next question will come from the Chair of the Budget Committee, since we're talking about the budget, the gentleman from Kentucky, Mr. Yarmouth.
Thank you, Mr. Chairman. Hello, Mr. Secretary. It's great to see you. And I'm so pleased, as so many of my colleagues are, that you're sitting where you're sitting. You know, we've spoken a lot about immigration today, and I just have to make the comment that after spending virtually every day with you for 7 months back in 2013 as part of the Gang of Eight in the House, I can't think of anyone I would trust more with the welfare and lives of young children at the border than I would you, because you showed during that whole time and throughout your career how much you do care about people regardless of where they're from, and I deeply respect that. And some of the comments that have questioned your motivation or your caring, including from Mr. Cawthorn, just were way above the pale, and were really, you're owed an apology for that. But I do want to reference what Mr. Cawthorn talked about, because it seems to me that we don't really know everything about COVID-19 right now. That when you say follow the science, sometimes the science is incomplete and sometimes the science is unknown. And so just, wouldn't you say that it's true that we still have no idea as to what long-term effects might burden young people who contract the disease, even though they may not have a difficult time with it when they get it? Is that not the case?
That's absolutely correct.
And as a matter of fact, there's some evidence that young people do have long-term consequences from having contracted the disease. And we've got a lot more observation to do before we conclude that it would be safe for a 3 or 4-year-old to contract the disease. And that we should probably do everything we can to keep those kids from contracting the disease.
Precisely.
Yeah. The one thing I wanted to ask you about, there are so many things in the American Families Plan and the American Jobs Plan that I think are crucial, and I applaud the president and the administration for including them. You know, I think the 2 years of early childhood education, probably next to doing something about climate change, are the thing. It's the one thing we can do to guarantee a vibrant future for our country and our society, because these kids need every bit of foundation that they can get. And the whole issue of childcare and elder care and free community college, those things are things that you know, I think an advanced society should make available to its citizens. The one thing I'm concerned about is capacity. And you know, I know we talk about, for instance, adding long-term care as a Medicare benefit. Well, it would be great to do that. We could, you know, if we could find the money to do that. But just making it available, making people, giving them the benefit doesn't guarantee that they have access, because there's not capacity. So my question is, and I know that these things have to be worked out still, is the administration making plans, for instance, in childcare, to make sure that of that $225 or $50 billion for childcare, that some of that goes to capacity building, so that we aren't just giving people an empty promise when we say, here, you have this benefit now?
Congressman, absolutely. We'd like to make sure that the progress can't be retracted or dismantled. And so we need to make sure that we're creating that architecture that lets us always know that we're going to be able to deal with childcare the right way.
Right. And that's why it's probably very appropriate to call it infrastructure.
Absolutely.
Since we've had that debate, yeah.
As I said, it's as Frederick Douglass said more than 160 years ago, it's easier to build strong children than to repair broken men. You're building kids. You're building the future of America, and that's infrastructure.
Absolutely. Well, I look forward to working with you to get the American Families Plan and American Jobs Plan passed, and on other matters as well. Thank you for being with us, and I yield back.
Thank you.
Thank you. I don't see any members who have not been recognized. If not, I recognize myself for questions. Thank you, Mr. Secretary, for being with us. I have a couple of quick questions and a couple of probably deserve a longer answer. First, you are preparing for the next pandemic. will part of that preparation include buying America so that we have an industrial base making masks and things like that? We've heard from a lot of domestic mask manufacturers that say they can't compete with masks being subsidized in other countries. Can we count on you to consider the industrial base and purchasing in America to the extent feasible?
Absolutely, and thank you to you and your colleagues who voted for the American Rescue Plan, because you made monies available for us to make those investments in domestic manufacturing.
Thank you. I talked to a ophthalmologist earlier this week who said that he was volunteering to help do vaccinations and man the phones for questions. Is the Medical Corps of Retired Physicians part of that preparation?
Absolutely, and we just started up a youth corps as well to help get youth vaccinated. We're now turning to their peers.
Good. We mentioned CAPTA, the Child Abuse Prevention and Treatment Act. The House, with bipartisan support of this committee and the full House, passed stronger CAPTA, much more money in prevention and other improvements. As you're aware, that's over in the Senate. Any help you can provide would be helpful.
Absolutely.
The other question is on the prescriptive drug negotiation. You'll save the federal government a lot of money. One of the criticisms of the bill is that corporations with making less money might do less research. Isn't it true that a lot of the savings will be put to the federal government, will be spent on research?
That's absolutely correct. In fact, we're going to be providing them even more incentive to do more production because of the research possibilities.
Thank you. You were in Congress when the Religious Freedom Restoration Act passed, and it has been, I believe, abused in many ways, including allowing discrimination in federal contracts, which I don't think was ever anticipated. There are some groups that have been granted waivers and are discriminating not only on employment, but also in services. Would you give a second look at contracts that allow a federal contractor with federal money to say, we don't hire Catholics and we're not going to provide services to those of the Jewish faith?
Congressman, we're against any form of discrimination. We want to protect people's rights, including religious freedom rights, but we also want to make sure folks aren't discriminating. So we will take a close look. If there's anything, and you know in particular, please let us know, but we're going to do everything we can to make sure we enforce the law.
Thank you. The American Rescue Plan improved the affordability and eliminated the cliff on subsidies for those getting health care through the marketplace. Can you briefly describe why it was important to eliminate the cliff and to improve the subsidies?
Congressman, that one's a no-brainer in so many ways. You have families in the middle of America who are working hard. They've got protection under the Affordable Care Act. All of a sudden, if they're fortunate to get a slight increase in their salary as a raise, all of a sudden that triggers their loss of all their subsidies. And from one day to the next, they've got coverage that they can afford, to all of a sudden it becomes really difficult. No one should have to go through that kind of experience where they fall off a cliff. Thank you for what you did in the American Rescue Plan to save millions of American families. And today we've got not only families who can afford to continue their care, but we got a lot of individuals who are signing up under the Affordable Care Act and getting plans for less than $10 a month in premiums. More than 31 million Americans today have coverage, healthcare coverage, good quality healthcare coverage because of the Affordable Care Act.
And that cliff can be very expensive because you could be paying 9.5% of your income, $9,500. And if you go a couple of dollars further and lose your subsidies, you may be looking at the sticker price of $15,000. And we got rid of that cliff so that people don't have to suffer that shock. On this No Surprises Act, one of the provisions in there was a requirement that the Health and Human Services work with the Department of Labor and we provided funding. Can we count on you to work with the Department of Labor to make sure that the funding is equitably distributed so that both agencies can get their work done?
We're meeting regularly with the DOL team, and I can commit that to you.
Thank you. And my time has expired, so I will remind the committee that pursuant to committee practice, materials for submission for the hearing record must be submitted to the committee clerk in 14 days following the last day of the hearing. So that's close of business, June 23rd. Preferably in Microsoft Word. Only a member of the committee or an invited witness may submit materials for conclusion in the record. Materials must address the subject of the hearing. Please submit materials to the clerk electronically by emailing submissions to edenlabor.hearings@mail.house.gov. Again, Mr. Secretary, I want to thank you for participating today. The committee may have some additional questions, as you know, and we'll submit them for response in writing. The hearing record will be held open for 14 days in order to receive those responses. I remind colleagues that pursuant to committee practice, witness questions for the hearing must be submitted by the majority committee staff or the committee clerk within 7 days, and questions submitted must address the subject matter of the hearing. I now recognize the distinguished ranking member for any closing statement that she may have.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here today. Committee Republicans remember well how vicious committee Democrats were to the previous administration secretaries. I'll make the same commitment to you that I made to Secretary Walsh last week. We'll keep our disagreements professional, and we will continue to treat you and other administration officials with the respect your office deserves, no matter how unwise we believe your actions appear to us. I'm disappointed, though, that Democrats no longer demand cabinet secretaries clear their calendars. Chairman Scott was uncompromising with Secretary DeVos on this very point, but I noticed that dictate is non-existent for Secretary Becerra. Our pandemic response in June 2021 is much different from the crisis we were combating in June 2020. The American people are following the science and returning to their normal lives. And it is past time for Democrats here in the People's House to get back to business in person. Our families are grappling with many challenges. Some of their obstacles cannot be solved through public policy and should be addressed with a renewed sense of social solidarity. But some of their troubles are the result of irresponsible action from the Department of Health and Human Services. Forced isolation is intensifying a mental health crisis. Crowded, unsafe conditions for unaccompanied alien children at HHS facilities put these children's health in jeopardy, and a rushed vetting process leaves them vulnerable to human trafficking. Healthcare and consumer good prices are soaring. The Medicare Trust Fund is on the brink of insolvency. China is too closely intertwined with our biopharmaceutical manufacturing and research initiatives. But Democrats don't seem to care. President Biden's bloated budget proposal is as insulting as it is morally bankrupt. It seeks to strip Americans of their employer-provided health insurance, impose a socialist health care system, coerce Americans to fund abortions, and mortgage our children's future. I reject the Democrats' radical and unpopular agenda, and I know very well that the American people do also. Mr. Chairman, I yield back.
Thank you. And I now recognize myself for a closing statement, and I want to remind the ranking member that during the previous administration, the Secretary of Health and Human Services appeared before this committee just once. And we appreciate Secretary Becerra has made himself available for 4.5 hours today. Every member was able to ask 5 minutes worth of questions. Some regrettably went a little over, but we know this is not the last time that we're going to see the Secretary. So I appreciate his being with us today. And I want to thank you for discussing the department's budget request and your vision for transforming our public health system. Today, we reflected on the critical progress we've made under this administration to confront COVID-19 and recover from the pandemic. However, this hearing has made clear that our work is far from over, particularly as people across the country continue to lose their lives to the virus. We know that stronger investments in public health lead to healthier communities. And to that end, I'm pleased that we discussed how the department's budget request, the American Jobs Plan, and the American Families Plan will finally defeat COVID-19 and help people care for themselves and their loved ones as we build back a better economy. So thank you very much, Secretary Becerra. I look forward to continuing our work together as we, in this pandemic, ensure that people across the country will have access to quality health care. And if there's no further business to come before the committee, without objection, the committee stands adjourned. And thank you, Mr. Secretary, for being with us today.
Thank you.
Good.